of you? Okay. The topic today is going to be a introduction of yoga therapy, and especially introduction of yoga therapy in our healthcare system. Now the question is, you are going to be either a yoga teacher or you're going to do it for your self-training, improvement. Why do you need to learn about yoga therapy? Answer is absolutely simple. If you start working as a yoga teacher in any establishment, doesn't matter whether it is going to be yoga studio or going to be YMCA or it is a high-end place, first thing you will see, the first person who comes to your class, 75 to 80% will come with the underlying medical condition. I have a back pain, that's what I'm here. Because in my class, I can tell you 99% comes for underlying health reason, and all the healthcare provider, like the physician, nurses, physical therapists, they come for one simple reason. And if I tell you, you'll be surprised what it is. The primary reason is a failure of the medical support. They've been taking multiple pills. Now they started having some side effects. They know all about it because the healthcare provider coming and say, what can you do from the yoga standpoint to get rid of this medication or get out of this? We call it a pharmacomafias. The mafias are controlling us with the pills. Next is, every time, I've been doing it for years and years and years. I've been doing it here, okay, most of you probably don't know. I've been here almost 45 years in this area. I'm a retired cardiovascular surgeon. I retired about 20 years back, but I'm 39 and holding. I don't grow anymore, 39. I've been teaching. Okay, let me tell you about what yoga teaching is. Yoga teaching is sharing your own practices. Like all the physician comes to my class. I do a lot of big sessions called continuing medical education for the healthcare providers. I want to use it in my practice. I want to use it as I call integrative medicine. Answer is very simple. Why didn't you start doing it? You start doing it, you feel it, you'll be able to do it very well. So every yoga practice is therapeutic, period. If you are in a regular or a daily practitioner of yoga, you are going to have some health benefits. But what a yoga therapy is, what yoga is, let me go over with you a few definitions. It's very important. The reason for this is that even when you will be a teacher, your students are going to ask you. First, they will ask you, what kind of yoga do you do? You don't do any kind of yoga. You are practicing a yoga from your scripture. Next thing we'll say what a yoga is. If you need to define yoga, yoga is the word. Yoga means the union of your body, mind, and spirit. But it's a philosophy. It's a philosophy called Yoga Sutra of Patanjali. It's 196 aphorisms, of which 193 is to quiet down your mind. It's a practice. Practice is called 8 limbs practice. And all the 8 limbs have to memorize. It has to be etched in your brain. Yam, social restraint, niyam, personal restraint, asanas, alignment, external, internal alignment, pranayama, voluntary control of breathing, pratyahara, control of senses. We'll come back again, but just giving you pratyahara, control of your senses. Dharan is a focus, dhyan is meditation, samadhi is the union of body, mind, and spirit. So what you have as a yoga, you have a philosophy and you have a practice. What the people do, they will pick and choose. You pick from here, you do this, then they will give a different kind of name. Yeah, I'm practicing Vini Yoga, I'm doing a Hatha Yoga, I'm doing this power yoga, I'm doing, but those are a given name. But the basic is the yoga from the scripture, a philosophy and a practice. So now what is yoga therapy has to do? Yoga therapy basically is a adaptation of the same practices based on your client's or patient's clinical condition. What does it mean? Somebody comes with a knee pain, back pain, hip pain, some kind of a musculoskeletal. You will probably start with a musculoskeletal work. And remember, we will do the practice session now, and you'll see the whole practice session will be relaxation response. Whole practice session, we call it a activation of parasympathetic tone. There were two kinds of tone, called sympathetic, which is called a fight and flight response. Parasympathetic is called calm and digest. When you are in a parasympathetic tone, you feel relaxed, you feel calm, you have a saliva in your mouth, like my mouth is now wet. When you're scared, what happens? The mouth becomes dry. So this relaxation response, activation of parasympathetic tone is the outcome of your yoga practice. And how to achieve that, that's what we're going to practice today. You may have a person who may send maybe their doctor will send it to you. That person may not have never heard of yoga, may not even come down. They'll have to sit down in a chair. It's great. We call it, there's a big name called chair yoga. Chair yoga, same is an adaptation of the same yoga philosophy, yoga practice. You have been using it. So during the practice, you will see we'll be using multiple tools. Like we'll be staying in a pose like asana. Then we'll be using a hand gesture called mudras. Then we'll be using our breath, the breath as a pranayama. Then we'll be using the stages in the holding. And then what will show it to you that you don't need to be mastering the poses, but you need to be in the poses in stages to get the therapeutic benefit. We'll see the whole practice will be based on activation of the both side of your body or both side of the brain. The biggest issue today for us is the underlying chronic conditions, whether it's a diabetes or the hypertension, the heart disease. We have looked at it, and we'll come to you slowly and slowly. We'll see this is called a part of the brain, which is called an emotional brain. Part of the brain, which is called a limbic system, which activates with the emotion. And primary emotion is, we call it a stress. Stress is nothing but we call it sympathetic overdrive. And the stress comes from, today, we see primarily from insomnia and sleep apnea. So yoga goes to the root. Yoga will go to the root, how to improve, how to sleep, how to correct your sleep apnea. But on the other hand, you will see that we will be practicing, like I'm sitting down with the cross-legged, and I'll show it to you very slowly in the practice, that in a short time, when I'm comfortable, I'm going to change my foot. I'm going to the cross opposite side. Why do I do it? Because I need to activate both sides of my brain. We'll teach all of you, and you'll be doing it. I'm right-handed, right-footed. I'm going to use my left hand and left foot for all my practices. In fact, the way I do it, I even started brushing with my left hand. Initially, The brush is all over. When it comes to your mouth, you can brush it. But when you brush your teeth with the left hand, you'll see your right hand is doing like this. Because your brain has an imprinted memory. And in medical term, it's called a neuroplasticity. Or in the normal term, we call it habit forming. But if you're using your left hand, and when you're using your both the feet equally, both the side of the brain, right brain and left brain, gets activated. And simplest way of telling you is that suppose you have a bike, and the bike, both the tires need to be properly inflated. If one tire is not properly inflated, bike is not going to work. As simple as it is. So for me, like I'm always see, I have my mouse, computer mouse. I use it with my left hand, but I'm primarily right-handed. But when I use my left hand, I'm using my fine motor coordination with my left hand. So we'll talk all about it. So any of you who do not have my Facebook link, all of you should have it in the email. So it is 9:16 or 17. Let me get ready to start the Facebook. So all of you will join me Facebook on the practice. Then after that, you will take a little comfort break and you'll come back to this Zoom again at 12. Any question or everybody asks me, why do you want to learn yoga therapy? What is yoga therapy? What is yoga? I mean, it's a very simplest thing. I'm getting some chat and sometimes hard for me to read because I'm from a little distance from my computer, but I will try, come close. Okay, never mind, we're all good. I received one from Amanda. Did anyone get an email from Linda? Okay. Crystal, is it the Facebook page with the link that also just send an email? Yes. Can you put the link on this chat so when nobody has it? Who is that? Crystal, will you please go ahead? Crystal, go ahead and put the link on the chat. Karen, hi Karen, hi. Very nice. So please put it in the chat, the link, so everybody can have it. And any other question? So everybody's okay. I get more message. Oh, here it is. Thank you. Thank you, Michelle. Very nice. So if you click it, it goes to my page or it goes to my timeline.
Are we practicing? Oh, shit.
Go ahead, I'm listening. Are we practicing what?
Yoga right now?
No, at 9:30 and 9:30 on the Facebook page link. You should be comfortable in a mat. If you can sit down in a mat or sit in a chair, it's fine with me because this is therapeutic yoga. You can be in a chair, you can be, but most of you look very functional, flexible, pliable, head down, feet up. So you can be sitting. Should you prepare to do yoga during the Facebook Live? Yes. Or if you want to watch it, it's fine. I mean, it's your choice, but if you do it, you'll feel good. And my one is totally relaxed environment. Anything else? I see somebody here. Who is this? Oh, Jasmine. Hi. Okay. So let me, anything else? Or I'm to go back to my Facebook. I'm going to end this one because Zoom is funny. You know, if I do another one, you cannot go back to the Zoom. So I'm going to end this session now, and we'll come back 11:45 on the same link. Bye. See you soon in the Facebook Live. Good morning. Today is Saturday, July 10th, 2021. This is our regular Saturday morning Facebook Live class, and this is also part of our today's program, a yoga teachers training from National Yoga Academy, Virginia Beach, Virginia. So these students, the 200 hours yoga teachers training classes, they're going to have a whole day session on introduction to yoga therapy. So we already have discussed with the students what is yoga therapy, but for all the bigger audience, which we describe every time, but let me go over with you again, that yoga, which the original Sanskrit word is called yog, anglicized version is called yoga, so that's what we use in West as yoga. It's a philosophy called Yoga Sutra Patanjali, 196 aphorisms, of which 193 is to quiet down your mind. It's a practice called 8 limbs practice, called Patanjali Ashtanga Yoga. 8 limbs are, you all memorized. That first is there. Yam, social restraint, niyam, personal restraint, asanas, your alignment, both external, internal alignment, pranayama, pranayama. Prana is the life force, yama is a controlled restraint. It is a voluntary regulated breathing. Pratyahara, pratya means reject, ahar means your intake. That means you're controlling your 5 senses, all the information you receive through our 5 senses. Dharan is the focus, 6th, 7th is your dhyan, which is the meditation, and 8 is the samadhi, which is union of your body, mind, and spirit. Every yoga therapy practice is a relaxation response, activation of parasympathetic tone, and it creates a body's physiological changes, which corrects all of our underlying chronic medical condition. Yoga therapy primarily is adaptation of the practices based on the client's or the patient's clinical condition. That means learning how to use the same tools, same yoga philosophy, same yoga practices, learning how to use them based on the patient's clinical condition, and the reason being If you are a yoga practitioner, today, anybody coming to your class will be coming for an underlying medical condition. Now you are here, somebody came to you, and you are going to guide them. First of all, this person may not even ever heard what yoga is, and you are going to introduce them a step-by-step for a yoga therapy. And remember one thing, I get this here all the time. I cannot do this asana, I cannot do this pose, I cannot do this pranayama. No, you don't master the poses, you don't master the pranayama, you don't master the meditation, but you practice it in stages for its therapeutic benefit. I cannot do a headstand, I don't want to do a headstand. It's fine, but keep your head down. Keep your head down and feel what happens. Put your head down, you'll be miserable. You can talk, you cannot breathe, your face is all flushed, is all red, your pressure inside the brain is high up, pressure inside the eye goes high up, pressure inside the neck goes high up. Just back off a little bit. You're short of pain, completely effortless breathing. Stay in that posture for a while. 1 week, 2 weeks, 1 day, 2 days, 1 month, 1 year, doesn't matter how long it takes for individual person, you will see you feel comfortable in that posture. Bring your head down a little bit more. Because what is happening, your relaxation response is setting in. And the brain is getting a signal, what is called neuroplasticity, neuroplastic habit forming. It will let you, I'm sitting in my cross-legged, I'm not sitting, my brain is allowing me to sit. Cannot sit down in the cross-legged, sit in a chair. Sit in a chair. What are the basic requirements for yoga therapy to practice? First requirement is able to sit down with your spine straight. No question about it. You sit down anywhere, any place, keep your spine straight. Next question comes, why? The moment you keep your spine straight, remember my skeleton, if you leave my skeleton, is going to fall in front. All the muscles on the side of skeleton, these are called paraspinal muscles. These muscles contract to keep me straight. So when you feel it, there is a look like a piece of 2 bricks sitting here. But if I keep my spine straight voluntarily all the time, these muscles cannot contract it too long. Muscle is going to relax slowly and slowly. When the relaxation takes place, before the muscle relaxes, it causes a little bit of a twitching. Then it completely stabilizes. It's called beginning of an asana. Then it's called a stability. Then it's called a profound relaxation. When the profound relaxation takes place, you feel there is a 2 pillows, soft pillows sitting here, and you practice it as a lifestyle. Yoga therapy is also a daily routine, the lifestyle. You do it all the time. You sit down like this when you're eating, sit down like this when you're driving a car. Sanskrit is called Merudanda Achal, spine is straight. Then it's called mind. The mind has to quiet down. How the mind quiets down? Mind in yoga is a content of your 5 senses. What I see, what I hear, what I smell, what I taste, what I touch. All the 5 senses when the contents are put together, that keeps me awake, alert, and active. If I learn how to shut down my senses, my mind quiets down. Most important sense is my vision. Eyes is a direct extension of my brain. I learned how to close my eyes. I have patients. I'm a physician, I'm a physician. My patient said, I cannot close my eyes. I close my eyes, I feel almost restless. Slowly and slowly, we learn to close your eyes. Use your hand gestures called mudras. Mudras are called hand gesture. Mudras connects your body and mind. Why hand? Half of our brain controls our hand. If you look at our brain, it's called a homunculus, like a short human being. 1/4 of our brain controls my head and neck. From this part to here, 1/4 of my brain. Half of my brain is my hand. 1/4 of my brain controls the rest of my body. Hand quiets down my mind. Then comes your breath. Breath, lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to keep it open. You have 4.5 liters which you can exchange. So learn how to breathe out first. Take a deep breath in slowly, then breathe out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. So you learn those things in stages, how to do the breathing. You have to practice your breathing. We'll go through all the different breathing. In fact, we'll do the whole pranayama practice this afternoon with our students. We'll do pranayama and a meditation. And this morning, we'll primarily practicing asana practice. When you do the pranayama practice as a therapeutic yoga, it will be totally, we call it effortless ease. Effortless ease means you are able to talk. You are able to sing. You are able to do this as if it's your normal breathing cycle. Same with asanas. If you feel any pain, you back off. But if you can be comfortable, sit down. So we'll teach you slowly. Let's come back and then we'll start relaxing. Relaxation of your hands, your wrist, your elbows, your shoulder, your neck, upper part, and how to create a relaxation response. For me, sitting down for a while, so what I do, I go back, change my feet, and sit down in an opposite direction now. What happens here, that my opposite side of the brain is now active. And you will notice your one side feels easier than the other side. Now, you cannot sit down on the ground. Let's see what we'll do. Suppose you want to sit in a chair. You'll sit in a chair. Just a simple chair. So what you will do in a chair, when you sit down in a chair, suppose you sit down in the front of a chair, but you keep your spine straight. Your body will be like a 90-degree angle, here, here, here. If you cannot touch the feet, you can put something underneath the feet. And most of the thing I like to put is a folded blanket. What is a folded blanket? So you can, when your neuroplasticity sets in, you can remove part of the blanket. Then if you go all the way to the back of your chair, then you keep your spine straight. That's the way I use my computer. My computer screen is here. My keyboard is here. I'm doing it. I'm not hunchbacked. The moment you're hunchbacked, you are creating the tightness, creating all the diseases. This is the way you'll be driving your car. This is your 24/7 yoga practice. People say, how long you do yoga? You do yoga 24/7. I'm always doing yoga. So, spine straight. When you stand up, you'll see when you're getting stand up, You will be standing up as if your ear, your shoulder, everything has to. We'll show it to you. We'll show it to you. But look at what I do. I've been doing it for a long, long time, all my life. I use a special chair. These are called kneeling chair. I don't know if you've ever seen it or not, but I have it. This is probably my third or fourth one. I always use this kneeling chair. I have a bunch of them. This is the one, little fancier one. I have a lot of lighter one. I show it all the time. So I will sit down in front of my computer, in front of my desk. What it is, you put your knees here, you're kneeling it down, your spine is always straight. You cannot bend your spine to sit in this chair. So from here, you'll be doing all the work throughout the whole day. Next thing, I get a question all the time, where do you get this kneeling chair? These days, obviously you know where to get them. It's called Amazon.com. Go to Amazon.com, type a kneeling chair. You will have hundreds of kneeling chair will come up. And I have many of them. Now, how to elicit a relaxation response? If you can sit down in the ground, or if you're in a chair, doesn't matter. The poses I'm going to do, you'll be able to do it in the chair also. I'm very comfortable sitting in the ground, so let me show you sitting in the ground. Take your both the feet, put underneath your knees, keep your spine straight. First component. Second component is your hand gesture, mudras. Touch your tip of your index finger and thumb. This is called a meditation mudra, dhyana mudra, or a jnana mudra, and put gently over your both the knees. Close your eyes. Remember the five senses. Most powerful sense is your vision. Remember, you are going in stages with a person who has never done yoga, never heard of yoga, came to you for a therapeutic practice. Close your eyes. Bring your awareness to your breath. In all the yoga practices, you breathe out first. If you're practicing with me, please practice with me and you'll see the difference. Breathe out first, effortlessly. Take a deep breath in effortlessly. Breathe out longer than breathe in, completely effortlessly. Wonderful practice. Now, let's do this practice because this looks a simple practice, but it is a powerful practice to create relaxation response. You can do, breathe out first, count of 2 in, 1 and 2 in, count of 4 out, 1 and 2 and a 3 and a 4 out. Then you progress a little bit, count of 3 in, count of 6 out, count of 4 in, count of 8 out. And whenever you feel a little bit of any effort, you stop, but you come short of it and keep practicing. Then you notice any pain. If you have any pain when you're sitting down, if you feel a pain here, you back off. Find a spot where you are feeling a little bit of we call it a comfortable discomfort, and stay in the posture. If you say it's hurting me, I'm not going to do it, you will never progress. What will happen if you do this relaxation with your eyes closed breathing, this thing is going to happen slowly. When this thing happens, then you switch your feet and see if you can sit down with the opposite feet crossing. What it does, it activates both sides of your brain. And you will see all the asanas we're doing, we'll be doing it equally on both sides. Now, let's do this breathing practice. Sit down, hand mudras, eyes closed. Let's do it count of 2 in, count of 4 out, count of 3 in, count of 6 out. You continue, we do it so long, we can do easily count of 8 in, count of 16 out, count of 10 in, count of 20 out, but do it on your own pace. And remember, yoga therapy is not competitive. It is your self-healing, art of self-healing, art of learning how to monitor your individual, excuse me, we do a jalneti, we wash our nose every morning, and during our practice, we do get some drainage back from our nose, but it's entirely normal, and this is a part of our practice session. You should do it. This is called your daily routine, dinacharya. Eyes closed, spine straight, hands touching index finger and thumb. Breathe out first. Count of 2 in, count of 4 out. You continue, but let me continue a little bit more. Let me do it count of 4 in, count of 8 out. Breathe out first. Count of 4 in. Count of 8 out. Very easy for me. I can do it count of 8 in, count of 16 out. Let me show it to you. How easy. But remember, I'm talking, I'm singing, I'm totally effortless. Count of 8 in. Count of 16 out. Wonderful practice. I feel a sense of relaxation. When a sense of relaxation, I progress. How do I progress? Take the one foot. If you're doing it with me, see if you can do it. Take your one heel to the back, put your one foot in the top, your knees drops down. This is called a Siddhasana, perfect pose. Now, if your knee is not dropping down, don't push it down. If it is up here, let it be here. If you push it down, what will happen? Come back higher. Close your eyes. Have your hand mudras. Continue breathing. This thing is going to happen. As simple as it is. Then if you're incorporated relaxation, like sitting in a chair, you do it with me, you'll be relaxing your hand. So if you look at a baby, babies are always relaxed. And we learn the whole yoga from the baby. If you look at a baby, baby will get up in a downward facing dog. Baby will get up in a cobra pose. Baby will be sleeping with a called, sleeping close angle pose called Supta Baddha Konasana. The way the baby sleeps, If you have insomnia, we tell you to sleep like this. Baby will close the hand. It's called a baby fist. How the baby closes the fist? Puts a thumb inside and close. This is a baby fist. Try it. If you do it, your hands will be relaxed. See, when my hands are relaxed, see, my fingers are all separated. My hands are relaxed. Initially, it was very tight. It doesn't go through. Now it goes through very easily. Now my hands turn around. You can do all this stuff. So you can put your hand in the front. You can do it with breathing. Breathe out first. Take a deep breath in. Breathe out and close your hand like a baby fist. This is also called a yogic fist. Breathe in, breathe out. Then do with your eyes closed. Eyes closed, breathe in, breathe out. When you do eyes closed, you pay enough attention to your breath. Wrist gets relaxed like this. You can do both hand and wrist together, like wrist here. When you bring it down with a yogic fist. Breathe in, breathe out. Breathe in, breathe out. Do with your eyes closed, you will have a profound sense of relaxation. Even when you can relax your hands, you will see the relaxation extends the rest of your body. That's called a holistic practice. That means yoga, it covers your whole body and mind. Our Western medical practice, we call it a reductionist. It affects only one side. Subcarpal tunnel. In Western medical practice, you'll be working on your wrist because you have a carpal tunnel in the wrist. In yoga, I'll say your posture, you are a hunchback that's causing your carpal tunnel. Correct your posture, you'll see carpal tunnel will go away. Comfortable like this. Now I do the opposite side. Now it is my other foot here. My other foot comes up, drops down. As easy as it is. Elbow gets relaxed with it's called the inward rotation. It's called the pronation. Elbow gets tightened up with this called a supination. It's called pronation. It's called supination. So, say tennis elbow. Tennis elbow is when you take the ball and try to hit with the bat, you have a external rotation, which causes a pain. So it'll be internal rotation. Internal rotation, a powerful tool you can do is called a prayer pose to the back. If I do a prayer pose to the back, which I'll do it very soon, you will see my hand will have a inside rotation called the internal rotation that relaxes your elbow. Shoulder joint is a ball and socket joint. So you can put your hand in the shoulder, slowly bring your elbows together. If you cannot bring it close, wherever it comes, if it comes here, don't cause a pain. If there's a pain, you back off. From here, you breathe out first, take a deep breath in, slowly rotate your shoulder. Breathe in, breathe out. This looks like a so simple practice, but it has a profound therapeutic outcome. How do we know? Because we monitor our physiological changes. Do it opposite. Breathe in, the opposite side. Have your eyes closed. Pay attention to your breath. No pain. Effortless breathing. See, I'm talking. I'm singing. I'm breathing. That is my practices. I'll be talking when I'm doing my shoulder stand, headstand, my peacock pose, you name it. I'll be talking. So now I'm comfortable here. What I do, I go a little bit more. This is called your half lotus. So I'll be eventually getting into a lotus pose, sitting down, but I'm going in stages. So now I have pain. I feel pain here. So what I do, I back off. Find a place where I don't have any pain, but it's not comfortable. I have a little bit of a discomfort. Very important. Pain here, back off. Somewhere you find. The moment you say, I have a pain, I'm not going to do it, you will never progress. And most important thing is that if you do not take a pain medication and do a asana practice or yoga practice, but the moment you take a pain medication, this is your normal body's response telling you that you are creating an imbalance in your body. Don't do that. Do not take a pain medication and practice yoga. Now you're not relaxed enough. So you use another tool. Remember, the five senses keeps us awake, alert, active, and tight. Shut down your five senses. Then our brain has a vibration. Brain is in a state of vibration, which we can record it. We call it electroencephalogram, EEG. In fact, our whole body cells are vibrating. We create another vibration, which is called a sound of a bumblebee, and it's called a bumblebee breathing. The two frequency interacts. It's a pure physics. Two frequency interacts, cancels. It's called a harmonic resonance. Cancels the frequency, and the brain quiets down. How do you know it? See, in our day-to-day practice, we do with this, our health tracker. This is my Apple Watch. I can record my EKGs. I can see my heart rate. I can see all my body parameters here, physiological changes. So we are talking from a science-based practice. If I am doing the Bhramri Pranayam, the bumblebee breathing, we have done a EEGs, we have done a polysomnogram with a functional MRI. We see the brain does not respond to external stimulus. When you're doing a Bhramri Pranayam and you put a sound like this, brain doesn't get active. If you put a flashlight, the brain doesn't get any active. And the same thing as the Om. If you get own sound of Om, and in fact, all the spiritual sounds, you see, they all ends with the Ma. Shalom, Amen, Om. All of them in all these total spiritual practices, quieting down your mind. Then it's called palming and cupping. You palm and a cup, and that also activates your parasympathetic response because it's a branch of your vagus nerve. Vagus nerve activates your parasympathetic response. So let's do a couple of bumblebee breathing. And if you're doing it with me, you can do it. And I'm sitting here. See, this is a yoga therapy. You're using your asanas, posture, using your pranayamas, using your mudras, using your breathing, using your meditative postures. Put your both the index finger on your forehead. Use your three fingers to close your eyes. In fact, you could do another mudra. It's called a Shanmukhi mudra. Use your thumb to close your ear and close your mouth. You will do all the breathing through your nose. In yoga, you do not breathe through your mouth. God gave a mouth only to eat and talk. Breathe out through your nose. You will take a deep breath through your nose and will breathe out with the sound of a bumblebee. So breathe out first. Deep breath in. Breathe out with the sound of a bumblebee. Wonderful. When you keep on doing it, almost feel like you are not even connected in the body. Pumping and cupping. Take both the hands, keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses. Take both the hands like a cup. Put it over your eyes like a cup. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face. Then massage the ear, behind the ear, front of the ear, in fact, inside the ear. This is called an earlobe. It's called the auricular branch of the vagus nerve. There's a branch of the vagus nerve which comes, and all the vagus nerve activation is called afferent. That means signal goes to the brain, and the signal comes out as a relaxation response. Always, ear is very important. And remember, this is called auricular branch of the vagus nerve. Then slowly bring your hands and massage in front of your neck on both sides. Here is an organ called a carotid sinus. Carotid sinus, when you massage, also activates a parasympathetic activation. The nerve supply is through the called glossopharyngeal nerve. It's called a cranial nerve. But the afferent, the information going to the brain, goes through vagus nerve. Take your hands, massage in the back. Is the insertion of two muscles. One is called a trapezius, another called sternomastoid muscle. Both the muscles are supplied by your cranial nerves. Remember, we have the nerves coming from our brain and the nerves coming out from our spinal cord. Nerves coming out from the brain is called a cranial nerve, and you will see our eyes are supplied by the four cranial nerves. Very, very relaxing practice. We are all trying to relax our body and mind. So I'm very relaxed now, so I go to the opposite side now. So go to the opposite side is called half lotus, Ardha Padmasana, or called your swastikasana. The tightest part of your body is your neck. You relax your neck. Four postures, you go to the back and the front, side to side, look at the back, and then rotate your neck slowly. But do all with the breathing, that also you do with your bumblebee breathing, Brahmari Pranayama. And I'll show it to you just now. But before that, relaxing the whole upper part of the body is called prayer pose to the back. And let me show you how to do a prayer pose to the back. So I'm going to turn around. You will take a look at it and you will practice with me if you can. It's a wonderful practice. What you do, slowly take your hands in the back, wherever it is. If it is here, stay here. If you can bring it close to your hands, it's perfect. If you can slowly put your hands in a prayer pose, it's great. Stay here. Remember, when you can keep it here and do your breathing out longer than breathing in. Do it between 5 to 10 breaths. Do it with your eyes closed. The hands will go high up a little bit because relaxation is setting in. And in stages in time, you'll see it will keep creeping up slowly and slowly. It'll go up a little bit more. But you stay here. I teach this thing to the IT people who are in front of the computer, who are hunchback all the time. And old IT people has a high incidence of lifestyle-related disorders. They get a diabetes at the age of 35, 40, hypertension, heart disease. I mean, it's amazing. High cholesterol. It's almost like an epidemic with the information technology people, IT people. But see, I'm comfortable. I'm talking. I'm even singing. So when you were working in the computer, take your hands, put a prayer pose to the back, and stay in this posture. So come back where I started again, where I was. I had the right foot on the top as a half lotus, Ardha Padmasana. I have my hands to the back, all the way high up in a prayer pose to the back. Now I'll be relaxing my neck. So my whole lower part of the body, upper part of the body, whole head and neck will be all completely relaxed. So I breathe out first, take a deep breath in, slowly drop my neck to the back. And when I'm breathing out, I breathe out with the sound of a bumblebee, like this. You have no idea what kind of physiological change are happening. When you put your neck in the front, you try not to bend your neck so much. So when you bring the chin towards your chest, it is called your chin lock, Jalandhar Bandha. Chin lock stimulates your carotid sinuses. It's a profound relaxation response. See, my hand is started going high up again. My mouth is full of saliva. And that's the state you want to be to get a yoga therapy. One more time. But when you're putting your head down, be sure there is no pain. And always remember your breath is effortless. What it is, in yogic tradition says, a food shit to the breath shit. Means if you do any imbalance in your physical body, it will show up in your breath, which you don't want. The moment you have a little bit of effort in breathing or catching the breath, you stop. So let's do one more time. Breathe out first. Take a deep breath in and slowly put your head to the back. Breathe out with the sound of bumblebee and put it in front if you can do without any effort. Do side to side. Breathe out first. Take a deep breath in. With your eyes closed, you'll see will be relaxed a lot more. Breathe out first. Deep breath in. Look all the way to the back without turning your shoulder. See, my eyes are closed. My whole awareness is on my breath. Breathe out first. Take a deep breath in. Rotate your neck to the back, left to the back to the right, right to the back to the left. Drop your head down. Breathe out first. Take a deep breath in. What a wonderful practice. My hands are still in the back. I'm in a profound level of relaxation. What happens, the muscles of respiration, which are in your chest area and the back, they're also called skeletal muscles. They also get relaxed. They're also trainable. What a trainable means, like this muscle called pectoralis major, pectoralis minor, in the back of latissimus dorsi, these are all skeletal muscles. They can be trained, like here. If biceps, and I have these weights here, I can do 5 pounds. After a few weeks, I can do 8 pounds. Then I do 10 pounds. I do 15 pounds. It's normal. Do both hands, equally. So these muscles will get trained. So you can do count of 3 in, count of 6 out, count of 4 in, count of 8 out, count of 10 in, count of 20 out. Then when you relax, your breath gets so effortless that you'll be sitting down next to me and breathing. I will never even hear you are breathing. And these are the ads, breathing ads you will see in television all the time. Yes, there is a medication called what, Fassendra or something. Oh, this is the sound of a breath when you have an asthma or when your breath is not effortless. And this is the sound of your breath. They're close to a deer. They're looking at a deer when you are taking this medication. So you don't need a medication. Yoga will do it for you. So now I'm relaxed. What I do, take the other foot in the top, sit down. This is a lotus pose. Oh, it is so difficult. Nothing is difficult because you have not got in one time. You did it in stages, you use everything. It is a profound relaxation response. So to show it to you how profound it is, you feel a sense of lightness. Put your hands on both sides, push it down, your whole body goes up and stays high up, called Tolasana. And you can stay up as long as you want. Go higher up more and more. Just to demonstrate. Another powerful asana is called Yoga Mudra. Keep your spine straight and look straight. Put your hands in the back and slowly drop your head down and listen to your body's signal. What about your pain? If you feel a pain here, you back off. Find a spot where you little have a discomfort and stay. If you stay here, do your breathing out longer than breathing in. Between 5 to 10 breaths, with a few weeks, it'll come down here. There'll be no more pain. And with a regular practice, you'll see your head will all come down. Slowly and slowly, it will touch the ground. And you'll be comfortable staying here. How long you stay? Initially between 5 to 10 breaths. Then you can stay a little longer and longer. Another relaxation practice, your eyes. Remember in your posture, both the feet has to be adequately grounded. That is called balancing poses. You have to learn how to balance your both the feet. And we'll do it, and I'll show it to you when I stand up. And activate both sides of your brain. Like when you're walking, put your right foot first, then the left, right, left. Getting up in a steps, right first, then the left, right, left, right, left. Don't get one foot. I see people going high up, right, 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 right. No, alternate. Get down, same way. Right one first, then the left one. Right one, left one. Or left one, then the right one. Balance it. So if you think our body is like a car, these feet are like your wheels, like tires. But they have a steering wheel. Your steering wheel is your eyes. You need to learn how to relax and balance your eyes. Why? Eyes are supplied by 4 cranial nerves. In fact, eyes is a direct extension of your brain, and eyes is your mind. In yoga says that the mudras, hand gestures. Whenever you have a hand gesture, because hand is supplied by half of your brain, eyes goes there. Jatha hasta tatha drishti. Means wherever your hand, that's where your eyes goes. Jatha drishti tatha mana. Whenever your eyes goes to your mind, is your brain. Jatha mana tatha bhava. That means whatever is your mind, it goes to your emotion. The emotions are the site, your soul is in the heart. Jatha bhava tatha rasha. Rasha is your 9 emotions. So when you learn how to control your emotions, that's a part of the brain called a limbic system. The 2 nuclei called amygdala and hippocampus. Amygdala responds to fear, hippocampus responds to memory. It sends a signal to our body's homeostasis called your hypothalamus. Hypothalamus sends a signal to your autonomic nervous system. It balances between your sympathetic and parasympathetic nervous system. It also signals to your pituitary gland, the master endocrine gland, so-called a pituitary adrenal axis, pituitary through the adrenal gland. It creates a hormonal homeostasis. That means all the hormonal changes get balanced. Medical term is called a psychoneuroendocrinology. Wonderful practice. So in the eyes, what you do, primarily, you do an eyes practice that you focus in your eyes. So what you will do, you'll be looking at a finger, or we generally do with call it jyoti tratak, like you light up a flame. Generally with your oil lamp or a candle, Look at the flame, exactly level of your eyes, and then keep looking without blinking. Because blinking is both voluntary and involuntary, and relaxation response basically is voluntary control over involuntary function. Slowly and slowly, you can even bring it close to you. And when you bring close to you, many a time what you can do, somebody else can look at your eyes, or even you can take a selfie to see the position of your pupil. If both the side of the brain is balanced, when you bring your finger close to your nose and you look at your finger with both the pupils should be equal distance from your finger. If they are not equidistant, you have an imbalance between the side of the brain. And how to balance? You do the rotation of your eyes. Put your hands on both sides. Then, without turning your neck, look to the right, left, look to the right. Look to the left, look to the right. Look left, right. Turn your hands high up. Look right high up, left down. Right up, left down. Right up, left down. Turn it other way around. You do left up, right down. Left up, right down. Left up, right down. Then look high up, then down. Up and down. Up and down. Then you do look high up, left, bottom, right. 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 Up, right, bottom, left. Up, right, bottom, left. Up, right, bottom, left. Up, right, bottom, left. Wonderful practice. Eyes movement, balancing. Eyes are supplied by 4 cranial nerves. We used to remember in medical school called SO4, LR6, superior oblique. There's a muscle supplied by the 4th cranial nerve. Alone, one nerve supplies one muscle in the eye. LR6, lateral rectus, supplied by 6th cranial nerve. Doesn't supply any other muscles, only one muscle's in the eye. Optic nerve, 2nd cranial nerve, supplies the main retina to see our vision. In the trigeminal nerve is the 5th nerve which supplies all around your eyes. So you're relaxing your eyes, upper part of the body, even lower part of the body, all this, or you can do another way, lower part of the body. So lower part of the body, you put your feet straight high up and sit down. This is called your Dandasana, stuff pose. Hands on both sides, spine straight. Then for the toes, separate your toes. Breathe in, breathe out, bend your toes down. Breathe in, breathe out. Close your eyes, breathe in, breathe out. The moment you can separate your toes, the toes gets relaxed. Remember, feet, ankle joint is carrying all the weights for you. Always practice with your breath. So breathe in, breathe out. Breathe in, breathe out. I do all the time, every single day I practice with my eyes closed. And with this practice, I don't know if I told you before, I had an open heart surgery about 20 years back. I'm completely almost like a disease-free, medication-free. I'm enjoying a good quality life. Breathe in, rotate your, breathe in, breathe out. Do it opposite side. Breathe in, opposite side. A profound level of relaxation. Remember, when the body is relaxed, blood vessel get relaxed. Your blood vessel in the heart, called coronary arteries, gets relaxed. The lining inside the blood vessel called endothelium. The plaque, hardening of the arteries, that also slowly and slowly goes away. Blockage in the artery starts to open up. Remember, we all talk about hip joint and knee joint. Hip joint and knee joint is carrying all the weight, but all the weight is carrying in the ankle. You relax your ankle, you have a profound level of relaxation. Seated forward bend. Take your hands, see wherever it goes. It's okay. If it goes all the way down, if you can hold your toes, it's great. When your body gets a little bit of relaxed, you look straight, keep your spine, and keep coming down. Don't bend your knees. So you will come in stages. People always ask me, I can bend my knees, I can bring my head down. No. If you want to do that, it's fine. But what you want to do, keep your knees straight, use the power of your breath and power of a relaxation for the body to come down. And the body will go into coming down slowly and slowly. You come to a point, you will see, for me, I can even clasp my hand. And head is coming down, but I'm still talking. I'm still breathing. All the way down, my head is touching my knee. And I stay here. Stay here between 5 to 10 breaths. Paschim Uttanasana, seated forward bend. When your toes are separated, your pressure transmission takes place. It's a wonderful practice. When you put your feet down, you'll see your toes are all separated. In fact, the market is full of it. Yoga toes, yoga socks, yoga shoes, but that all are geared to separate your toes separate. You have sandals. I have all of them. You know, people give me the gift, or we have the yoga toes. But for us, I take one foot on the top, take my hand, I put my fingers in between my toes. Initially, it was very difficult, but slowly and slowly I can do it. Take my knee, slowly bring it up. Here's my baby. Breathe out first. Take a deep breath in. Slowly let the baby go down, and then he goes all the way to the ground. If it doesn't go down to the ground, if it is here, I let it be here. Continue my breathing, continue my relaxation, and this thing will happen. Remember, if I push it down, it's going to come back again. This thing will do on its own. Knee is the site of fear. Hip is the site of emotion. Stress is nothing but a fear of unknown. Knee is relaxed, your stress is under control. When emotion, what is emotion? Hypertension, high blood pressure is an emotion-related disorder. Go to see your teenager's room, your blood pressure goes high up. Talk to your boss, your blood pressure goes high up. Emotion is related to your all neuropsychiatric disorders. Balance it, do both sides. Bring your other feet high up. The left hand, separate your toes. I do it all the time. In fact, I do this, then I do my pranayama practice. Like if I do a bastrika, like a bellows, I'll sit down, put my hands here, I'll put my knees here, I'll do. I just did simple 100 of them. I can do 400, 500, 600. completely effortless. Again, I bring my baby high up. See, I'm talking, I'm breathing. All the breathing I did is my normal breathing. So people ask me, how fast, how slow, how long? Number is only one. Effortless ease and listening to your body's signal. As if it's a normal breath, initially to 30 seconds is good. You still can do 30 seconds today. You'll be able to do 3 minutes very soon. It's a wonderful practice. Breathe in, breathe out. Hip joint relaxation. Baddha Konasana. Put your feet together. Bring it slowly here. Hands here. And butterfly. Slowly you can do. There is no rush. Spine straight. Eyes closed. Your knee joints will come down slowly and slowly. Always pay attention to your breath. Always keep your eyes closed and always bring your awareness to your breath or visual imagery. Visual means you can focus your mind. So we'll be showing you a few more practices for the balancing, but one of the most important balancing practice is able to sit down with your one knee in the top of the other one. And remember, if you cannot sit down, it's okay. But try where you can. This is called your buffalo pose, Vaisasana, like a buffalo or a cow. You'll sit down like this. This is the beginning. Then you do what is called your cow face, Gomukhasana. And I'll show you how to do equally on both sides and what is the effect of it in your body and mind. And what is the relaxation you can sit in. Remember, these are called powerful therapeutic asanas because it's relaxing your whole lower part and upper part of the body. When you're able to relax, you can put other foot in the top. Or you can do another asana. It's called Ardha Matsyendrayanasana, spinal twist. Let me show it to you how to do it. Then you will know what the breath does to your bodies, okay? So we can do both the asanas together, or okay, you can do this, or you can do, see, if you can put your one knee on the top first, I'll show it to you. I'll turn around and show, but in this I'm showing in the front. Put your one foot here, right knee. Left hand goes outside your right knee, right hand goes to the back, left hand slowly turn around, comes, touches your left knee, then the left ankle, then your left foot. Close your eyes, breathe out first, take a deep breath in, and slowly turn your body to the right. You'll see at a certain point, your breath catches. When your breath catches, you back off. Stay here. Breathing out longer than breathing in, about 5 to 10 breaths. When you do it equally on both sides, both the side of your brain would get balanced. So you're not going to do all this in one day, but you are doing it in stages. See, I'm sitting here. When I started, I sit down here. I may sit down for weeks and weeks. Yoga therapy is a powerful medication, but it's a very slow medication. Meditation is medication. will teach you the pranayama and meditation this afternoon. So now I feel a little bit of relax. I push my left knee out, get my right hand outside my left knee, left hand goes to the back, comes down to your knee, and slowly comes down to get into your ankle. Breathe in and out. Slowly turn your body to the left. There's a very lost in translation, funny translation of this pose called Lord of the Fish pose, Ardha Matsyendranasan, but it's the name of a yoga master on which this asan's name was derived. So look at other therapeutic asana, is a wonderful therapeutic asana, is your, say, cow face, Gomukhasana. See how effective and balanced both sides of your brain. My right knee is in the top of my left knee. My right hand goes high up. My left hand is here. I put my left hand in the middle, in the center. The right hand will come down. It will touch it, hook it. Essentially, I'll be handshaking each other. But I'm so relaxed. I'm staying in a relaxed pose. I'm comfortable, I'm talking, I'm breathing. Go back to the opposite side. Now my left knee is in the top of my right knee. See, I sit down a little bit, I breathe, I get into the state of relaxation. Left hand goes high up, right hand comes here. I put the right hand in the middle. Left hand will come down, it will touch it, hook it. Essentially, I'll be handshaking each other. If you're doing it with me, you'll see your one side is easier than the other side because you're all in a state of imbalance between right and left side of the body. When you can do it equally on both sides, you're in a profound level of a balance. And in yoga it says, health is defined as a balance of your body, mind, and spirit. Another wonderful practice is able to sit down, what yogis calls it a squatting pose or a malasana. You can sit down in a squatting pose. In a squatting pose, you see your ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed. Then you put your hands together, separate your fingers. This is the way hand gets relaxed. Extend your wrist gets relaxed. Put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Close your eyes, keep your spine straight. You breathe out. Then breathe out longer than breathing in and keep doing it with a profound level of relaxation. No disease will dare to come to you. Next sign of health. Able to get up from sitting without any support. From here, you will get up without a support. When you will be able to get up without a support, and then what you will do, you'll be able to get down and get up without a support, And that is going to do your health. See, I'm sitting down here in a squatting pose, and I'm getting up without a support. Then when I create a balance, normally my feet is in the shoulder distance. I'm comfortable. Going against the grain of your habit is your balance. It's a yogic principle called the law of opposite. We get always attracted to the attributes we have. So learn if you can put both the feet together. When you put both the feet together, you start in creating a balance in your body and mind. Then look at your posture, your ear, your shoulder, your hips, your knees, and the ankle should be in the same line. Called your Dandasana, like a stick. Body is like a stick. You get your hands high up. It will look like you are in a totally straight, and that's the way you walk. When you see somebody 90 years, 100 years young, you don't see any hunchback living 90, 100, spine straight. So look at this wonderful practice. Now you can cross your feet, creating a balance. Cross your feet. Crossing your feet, if you can sit down and get up without a support. Practice it. Initially, it will be almost impossible, but when you'll be able to do it, we call it a money back guarantee. Money back guarantee, your all chronic diseases will slowly going to disappear. Cross it opposite side. Sit down, crossing your feet in the opposite side, and can get up opposite side. When you become more relaxed, when your health gets better and better, what you will be able to do it, initially it will be almost impossible, you'll be able to do it, you will be able to go all the way down into the ground. Sit down in the ground. Have your feet crossed. Close your eyes. Do something, a deep breath in and breathe out without effort. And when you're relaxed enough, from here, you can get up without a support. Try this. Go all the way down, see if you can get up without a support. If you use one hand, you lose 25% of your health. If you use two hands, you lose 50% of your health. So, sit down again. Opposite side. Cross your feet in the opposite side. Sit down. Again, bring the relaxation, bring the awareness in your body and mind. Try to shut down everything around you. I cannot do it because you have too many inputs coming to you. From here, you don't have any inputs, you get up. When you get up, then you practice your balancing poses. Foot together. If you fall down, you always fall down with your hand, open hand. It is called, if you fall down, you get a fracture in your wrist. It's called a Colles fracture. Take your hands out. Just put a prayer pose to the back. Hands in a prayer pose to the back. If you're doing it with me, say try. If you can stand on your left foot. I'm a right-footed, right-handed, so if I can stand on my left foot. Initially, almost impossible. But if you try initially, you might be touching something. You may hold something and then try. Or you can put in a chair, touch in a chair. But when you get used to it, you can do it. 10 seconds, 20 seconds, 40 seconds. When you get a little proficient in it, close your eyes if you can do it. If you can do it with your eyes closed, initially it is almost impossible, but it is we said, money back guarantee for your health. I practice every single day in the morning. These are my routine. I don't teach. I share my practice and my knowledge with all of you. You can do so many asanas. You can do asanas sitting down, laying down, face up. We have so many asanas. But relaxation comes in with your balancing both sides of the brain. That's what therapeutic yoga is. We'll show you this afternoon that how to sleep, how to do the complete relaxation of your body and mind. Able to stand on the one foot, right foot. 10 seconds, 20 seconds, 40 seconds, and close your eyes. If you see if you can stand closing your eyes, it's a wonderful practice. Let me show you another practice, which you'll be very pleased if you can do it. We don't do any breathing pranayama practice standing up because pranayama causes an altered sense of consciousness. But pranayama is done in a very relaxed state. If in a relaxed state, so you can do it called Kapalbhati pranayama, breath of fire. This is, I'm not doing the pranayama practice, I'm just showing that I'm completely relaxed. So I can do a tree pose standing up, one foot here, can take another foot here, can do tree pose, and in a tree pose, I can do my Kapalbhati pranayama. Keep on doing it. Keep on doing it, and you will see the wonderful. Balance it on the other side. Always a balancing practice. Another thing, when you do tree pose with a hand in the back, is always different than putting a hand in the front. When you do a hand in the front and do a tree pose, and putting a hand in the back in the tree pose is entirely different. So, when you're putting the hands in the back, and also when you tree pose, the precaution, you generally try to put it below your knee, try to put your foot above the knee. Try not to put in the knee because knee stabilizes it. Another powerful yoga practice is for relaxation is to put a head below your heart. When you can put a head below your heart, a lot of physiological changes takes place. When it's head below your heart, initially, the pressure inside the brain goes high up, pressure inside the eyes goes high up, pressure inside your called carotid arteries goes high up. You feel miserable, cannot even breathe, cannot even talk. But if you keep your head down slowly and slowly, the neuroplasticity sets in. It's called a baroreceptor sensitivity. That blood pressure, the baroreceptor goes, and we can see it. We can see it all here with our physiological monitor. You know, Apple's Tim Cook said the next Apple Watch is going to be a health monitor. So let me show you what we're doing. This is called widespread head touching the ground, called Prasharito Uttanasana. So I'm spreading my legs slowly and I'm supported. My hand is supported, my knee. Remember, I'm the supported forward bend. Very important. When you do forward bend, when you do unsupported forward bend, create a lot of tightness here. Supported forward bend. Wherever you can come down. You come down a little more is good. For us, slowly and slowly come down, separate your feet as far as it is. You can sit here. And you can go all the way down, put your head down on the ground. Touch your right hand. On this posture, you'll be able to do a Kapalbhati Pranayama because you're relaxed. It's a wonderful massaging of a pelvic floor. If you do it, you'll feel the massage of a pelvic floor. For the men with a prostate problem, to massage your prostate gland. For the women, it will massage your pelvic floor. It's incredible practice, and when you do it, you can feel it. We have all the other standing poses, we can do it. That's okay. But this is, you create a relaxation. Lay down, the face down, on your ground, on your mat. You do the back bend on the mat. Back bend, you do your cobra pose, Bhujangasana, you do a locust Salavasana, you do a bow pose, Dhanurasana, but you hold into the pose. Don't get it in and out. Even if you do a cat pose, if you do a camel pose, stay in the pose. Stay in the pose between 5 to 10 breaths. Okay. Let me go ahead and sort of finish with you the most relaxation, that a relaxation you would be able to achieve. The how to achieve a relaxation, and then you will see any asana will come to you. You don't have to ask for. You'll be able to sit down very easily. It's called your Vajrasana. Sit down here, sitting down, very nice, spine straight. It's the most relaxing asana. When you're relaxing, okay, let me show you what the relaxation will do. To give you steps for like a headstand. I said, I want to do a headstand. Oh, I don't want to do it. I have a hypertension. I have a heart disease. My doctor asked me not to do it. I have a neck problem. Don't do it. Who asked you to do it? But if you're able to do it, it's such a relaxation response. See, pain, neck pain, back pain, everything. It's not your herniated disc, it's not your spinal stenosis. It's irritation of a nerve. It's a contraction of a muscles. All the pain will go away. All the chronic pain is due to tightness. Relaxation response takes away pain. For the seniors, the loss of balance, all the seniors will fall down and they'll die. When you do the balancing poses, your balance comes back. This is your stance. Put your stance here. Clasp your head. Put your head down. You feel miserable. Cannot talk, cannot breathe. Your face is flushed. Come back out slowly. Come back here. Put your head down. Still were miserable. Put your hand down. Put your head like on a hand. Still miserable. Put it here. Do somewhere, somehow, at certain point. But the moment you stay here for a few days, few weeks, you'll be able to do it here. 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 When your breath is normal, see, I'm taking a deep breath in, breathe out. I don't have any flush. I don't have anything. I just keep my body high up, keep walking. I keep walking, my body will go high up, but I don't do anything. I don't let anybody touch me. I don't let anybody help me. I'll keep my high up, and you'll see my whole body will go high up on its own. I do it every single day. Absolutely have no issue out of it. People do a Savasana, corpse pose for relax. But before corpse pose, you see, most relaxing is your sleep. Corpse pose is not the sleep. So you'll see who sleeps well. So baby, if you say baby, and if you say baby sleeping, you'll see baby is breathing out longer than breathing in. Baby also does some of the breath holding. It's called kumbhaka. And then you sleep like a yogi. Let's finish our practice with a relaxation sleeping and see how you'll be doing it. So you'll be going down to your mat. So go all the way down. Hands are on both sides. In a normal savasana, you separate your feet until the width of your mat. Keep your hands facing up to the sky. About 6 inches from your side, and be sure your head, see if your head doesn't go down, if you want to put something under your head, please put it under your head. Don't do this, put your chin way high up. If you put your chin way high up, we call it sympathetic. Try to put your chin down. You will see your breathing normalizes. Your abdominal cavity will come down, and a baby will do a abdominal breathing. Abdominal breathing is relaxing. Abdominal breathing is when you breathe in, you'll see your abdomen walls. When you breathe in, it will go high up. Breathe out, it will come down. Breathe in, breathe out. Then you need to see how the baby sleeps. Have you ever seen how the baby sleeps? Baby will take both the feet, and baby will put both the feet together and put the knees down like this. This is called Supta Baddha Konasana. Laying down, closed angle pose. If you have an issue, you can put 2 pillows underneath or folded blanket. This is a very nice called restorative poses. Incorporate your breath. The way I do my breath, I will do here, breathe out first. I will breathe in, say, count of 5 in, count of 10 out. Or say I'll do count of 4 in, count of 8 out. I'll do about 5 to 10 times. Let me show you a couple of times, see how to do it. Hands are on the side. I'll breathe out first. I'll breathe in with a count of 4 in. Breathe out with a count of 8 out. Again, I'll breathe with a count of 4 in. Breathe out with a count of 8 out. After doing a few times, between 5 to 10 times, now I'm incorporating my breath holding. I will do count of 4 in, count of 16 hold, count of 8 out. Generally what I do, then I start increasing, then I'll do count of 5 in, count of 20 hold, count of 10 out, count of 6 in, count of 24 hold, count of 12 out. Let's do count of 4 in, 16 hold, and 8 out. It's a 1:4:2 ratio. I'm all doing abdominal breathing. Breathing out first. Breathe in with a count of 4 in. Hold your breath with a count of 16. Breathe out with a count of 8 out. Do it again one more time. Breathe out first. Breathe in with a count of 4 in. Breathe. Hold your breath at the count of 16. Breathe out with a count of 8 out. Then slowly, initially, you go into your fetal position and turn onto your right side. And the reason is when you're turning into right side, your left nostril opens up. Your left nostril is a cooling breathing. It's called moon energy, Chandravedi pranayam. When you're sleeping first, your body core temperature is still high. So a cooling balances. Remember, yoga is a balance. And I will do it on the other side, you will see. But here, we put our head on your folded hand. We are in a fetal position, and that is where the yogis sleep. Initially, after a while, when the sleep cycle starts in, sleep has 2 cycles called REM, rapid eye movement, and they're called non-REM. Non-REM is the deep sleep. It has the stages, stage 1, stage 2, stage 3, stage 4. Stage 1 or 2 is very early, but stage 3 and 4 is a deep sleep. And that's a deep sleep you need. Then when you become a little bit more sleepier, then you sleep the whole night, you sleep on the left side. You've been on the left side, yogis don't have any pillow, they take the hands, they put it like this, and they sleep like this. I've been sleeping like this for a long, long time. And it suddenly, then sometimes I put a pillow and I put my head like this in a pillow, but I prefer doing, initially your hands might get numb, you might feel uncomfortable, but once you do it, it's a wonderful practice. What it also does, we have the main venous channel. The blood comes in a vein, it's called the inferior vena cava. Main channel, the blood comes and goes into your heart, so it does not get obstructed. So when somebody pregnant, like prenatal yoga or internatal yoga, they always stay in the left side. They will do even your savasana on the left side because you don't want the uterus to compress on the vena cava to block your return. So that's the way you get a proper venous return, and with the relaxation, your heart function improves. It's called increase in the preload, more blood returns to the heart, and decrease in the afterload. Like when heart contracts, there is no tightness, relaxes. You have a wonderful sleep. It's not the how long you sleep. People say you need to sleep 6 hours, 8 hours. Yeah, even if it's six hours, look at that. 6 hours, your 25% is the REM sleep, rapid eye movement, and 75% is the non-REM sleep. So 75% will be your 4.5 hours. Out of 4.5 hours, the first 50% is stage 1 and stage 2, and stage 3 and stage 4 will be another 50%. So half of 4.5, little less than 2 hours, even 2 hours. So if you get 2 hours of deep sleep, that's enough sleep to cause all the repair in your body and mind. See, my even breathing, even my wife tells me when I'm sleeping, my exhalation is longer than inhalation. Once you finish, slowly straighten up your leg, put your other hand high up, and able to get up, sit down, and then put your hand, this is called a lotus mudra, Padma mudra. Touch your little finger and your thumb. Separate your ring finger, middle finger, and index finger. It connects your body, mind, and spirit. Bring it slowly close to your heart. A yoga therapy relaxation is a wellness, physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us all the healing. Put your hands in front of your heart chakra, and finish with another palming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, slowly and slowly, if you're wearing glasses, remove your glasses. Take the hands, put it over your eyes like a cup. Let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face, massage your ear, behind your ear, in the front, earlobe, in the back. Bring the hands in front. I can't mess up because I have the damn part, but it's okay. You massage in front of your neck. It's called your carotid sinuses, relaxation. Massage in the back, the insertion of the two muscles, trapezius and sternomastoid muscle. Wonderful relaxation practice. And this is the beginning. As I said, this is the whole day of a class. So next Saturday, I'm going to be out of town. So there will be no classes next Saturday. And for the students, you take a little bit of a stretch break and you come back again at 12 o'clock to continue your class. Thank you again. It's wonderful to be with you every Saturday and hopefully to see you in a couple of weeks. And the most important thing is that the GI tract, gastrointestinal tract, is supplied by called parasympathetic nerve. What does it mean? Is that your food needs to be digested when you are in a relaxed state. When you are in a fright and flight response, your food doesn't get digested. So we will want to, and then the food essentially in yoga says the food has a taste. In West we say food has a protein, fat, carbohydrate. We talk about calories, but yoga says the food has a taste. We talk about four tastes: bitter, sweet, sour, and salty. Yoga adds two more. It's called astringent is the one, and called a pungent. Astringent is the one when you put a food in your mouth, the mouth contracts, like when you put a little tannin or you put a strawberry. There is an Indian called Indian gooseberry called amla. When you put in there, you definitely know it's a astringent taste. Pungent is the chili, the hot. That's a pungent. So you will see what you ate. Then I will go over with you a little bit of a digestion. And now let's go over and share with you some slides, and I'm going to show it to you how to integrate yoga as a therapy to modern medicine. And any question you have, you can either, it's hard for me to see the chat when I'm presenting. You can interrupt me and question me, it will be fine. Or at the end, we'll have some time to discuss question and answer or to hear your comments. And let me see, I don't have any sound. I need the slides to share with you. And let me see how this is going to work or not. Now, you guys tell me if you see the slides. Do you see the slides good enough?
Yeah.
Or I need to make it bigger than that? Okay, I need to close down everything because I don't see myself. Okay, I see myself here. Okay, the topic is going to be, and can all of you mute yourself? If you mute it, because there is no feedback. So if you need to ask me something, you can unmute and you can ask me a question, but please mute yourself. Put your video on, it's fine, like to see your faces, that's great. So, integrating yoga therapy with Western medicine. And here is all the hats I wear. I wear too many hats, but that's okay. I can handle it. So, all of you, if you have any interest in yoga as a therapy, I'd like you to be at least go to the website of International Association of Yoga Therapists. It's called IAYT, of which I was a president for 5 years, for 2013 to 2018. We have all we call it a standards, accreditation, certification, and most of us who are even in the faculty in your National Yoga Academy, like Amanda, so we are all certified, called Certified Yoga Therapist. It's called CIAYT. Another one came up, if you look at my first one, called a faculty member called VAYU. It's a Vivekananda University, the first yoga university outside India, in fact in the whole world, that is in the United States. Los Angeles, they started a master's program in yoga. It's called MSc in yoga, 21 weeks. It's supposed to be on site, but because of pandemic, it shifted to online. I do just teach or talk a little bit about yoga therapy over there. And finally, if you are interested, we do a program called Continuing Medical Education for the Healthcare Provider. And that's what we do twice a year, one in May and September. That we do through called Life in Yoga Institute. The chairman of the board, Life in Yoga Institute, all of them has a website. Ayurveda, you will have some lecture on the Ayurveda for yoga. Ayurveda we call it a sister science, but it's originated, its frame, Ayurveda and yoga. And the whole yogic practice is basically based on Ayurvedic principle and philosophy. It's a National Ayurvedic Medical Association called NAMA, which I'm a life member. And so just have your interest and proceed. And my telephone number, email address, my websites, all are there. And generally, I share this thing with all of you. There'll be a lot of information here. I'll send it to Amanda. And also all the information I have, generally I like all of you to get this book. It's called Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. The book has everything, all the pictures, every asanas. I have 250 asanas, all mine, asanas, pranayama, meditation. And the way it is set up is that you picked up an asana, say you picked up as a triangle pose, it will tell you that what are the indication, how to do it, and what are the therapeutic benefits. So these are all like a face down poses, or you can see the maybe the steps of, let me see if you get a, yeah, if you can see the steps of headstand, you know, the how to do the headstand in step by step. Anyway, so you can get this. This book is available in Amazon, and it's a very popular book. They're selling, you know, you don't, every time they put it, book goes away. But Amanda generally gets this book in a sort of called a publisher discount, because I have no interest on profit from this book. I wrote the book because all of you guys wanted it. I don't get any much money out of it. But as an author, and I said to my students, the publisher gives me 40, 30, 40, 50% discount. So it's a price is $49.99. I think he gives us to, Amanda knows very well. I forgot. Amanda knows. I think $29.99, 30. When instead of 50, you can get into that level of 30. So look at this book, and this is also in Amazon, but I'd like you to have this book. And the best thing will be when you're a teacher, when you're teaching a class, see if you're teaching a pranayama, breathing, you can look at a section on pranayama, and you will be able to just pick up the notes. In fact, I have all these yoga teachers, very famous yoga teachers in this country. They called me, oh, I'm going to teach a yoga therapy for eye health, you know, eye improvement. I said, yeah, I have a section on that. Take a look. I'm going to do yoga for hip pain, you know, so I have a section on that. So anyway, let's look at the pictures. This is, we call it a application of medical yoga in healthcare. It's a interesting story. Yeah, let me go ahead and put in the full screen so you will see better, I think. I just don't know why I put it here. Okay. So this is a better view. You can see very well. So just to summarize, you know, as all of you know, I have gone through it all the time, but I'm just going over with you again and again and again. It's a real word, it's called yoga. It's a union of your body, mind, and spirit. And spiritual, it's a spiritual practice. Spiritually, it is a union of your individual soul to universal soul. And if you think about our modern computer language, you know, your body is like a hardware, mind is a software, spirit is a programmer. You fix your software, hardware will get fixed. So who is fixing the software? The programmer. The programmer is me, I program my software, so my hardware get fixed. But in Western medicine, what we're doing, or modern medicine, we're fixing the hardware. Maybe a hip problem, you know, we are putting a hips, putting injection, putting a hip joint replacement, but we're not taking care of the underlying condition. You have a heart disease, you know, you have putting a stent, putting an angioplasty, bypass, you know, heart, but the initial condition is, you know, stress, insomnia, sleep apnea. Those they don't cover. So what happened? The disease comes back. Somebody has a stent put today, in 6 months down the line or 6 years down the line, they get another stent put in, another bypass put in. Very important concept. If you keep this one in mind, you will understand everything. As I said, it's a philosophy. You know, philosophy is 196 small aphorism called sutras. It comes in a 4th chapter. But most of them out of 193 is to control your mind. There's one in physical, what is called a sthiram sukham asanam. Sthiram means stillness. Here I am able to sit down with the stillness. Sukham is the happy. Asana is a pose. I'll be able to sit down in asana in a pose. So practice is called 8 limbs practice. And these are the 8 limbs. We said yam, social restraint, personal restraint, external, internal alignment is asana. Pranayama is a voluntary regulated breathing. Pratyahara is a control of senses. Dharana is a focus. That is a meditation, and samadhi is a union of your body, mind, and spirit. As long as you understand this concept, and this is the end of yoga therapy and the relaxation response, that I'm sorry, let me get it out of this way a little bit so that I can see all of them better. Okay. It is a relaxation response. It is activation. It's called parasympathetic tone. What is a parasympathetic tone? It's called autonomic nervous system. We have three nervous systems. Voluntary nervous system, I can open and close my hand. Involuntary nervous system, I look at a food, my stomach starts secreting juice. I have no control. Involuntary. Autonomic is doing all the time. I'm sleeping, I'm breathing. Sleeping, my heart is beating. But it's a function of a parasympathetic tone, and by repeated practice, you have a control over autonomic nervous system. So many long-term yoga practitioners, they're able to even stop their heart. They can stop their breathing, and they can restart it again on their own. I, as a physician, had a hard time believing it initially, but I've seen it, so I understand it very well now that it is possible. This is a very interesting thing we said. The whole yoga practice is called introspection. Introspection means you start looking inside yourself. See, the way it is, I'm practicing. I'm trying to touch the toes. Today I cannot do it. But if I stay there, as I see in the practice, what I showed it to you, that you keep your eyes closed, do your breathing, you'll see your relaxation sets in, the hand is coming down. Essentially, you see you're able to touch your toes. The moment you'll be able to touch your toes, the first thing will happen to you, you close your eyes, you said, start looking inside yourself. You know what? I couldn't touch my toes, what do I want to do? Let me see what I'm eating. Let me see what the food is getting properly digested. Let me see, is it becoming part of my body? Let me see what are the problems, why my body smells, or why do I have this recurrent, why do I have psoriasis, or why have a skin infection? Why do I have this, say, a fissure? Why do I have a irritable bowel syndrome? And it is just so important, and they say there is no problem in the world which does not have a solution. There is no disease in the world which does not have a cure. Awaken the doctor within you. Very important. And most important thing is we must make our body to work for us. It is so funny. So I just saw a cartoon another day. It said, I used to go out for a walk. Now I take my car out, so I save some time, and I don't feel tired anymore. So these are the cartoons we see all the time, but nothing has the greatest power to heal but self. And essentially in yoga therapy, at the end of the day, you learn and you find out that I'm the cause and I'm the cure. When I was born, I was perfect, I was healthy. So what did I do? I did everything to create these chronic diseases on me, but I'm the only one who will be able to take care of it. The father of modern medicine said it is more important to know what sort of person that has a disease than to know what sort of disease a person has. So you are, as a yoga therapist, somebody comes with a back pain, somebody comes with asthma, you have to understand. See, people come with a respiratory problem. They try to breathe in, but they get a fear. So it affects the mind. So now you start doing a breathing technique, a breathing, regulated, voluntary, regulated breathing. They're not going to do it. So what you need first to quiet down their mind. So you can slow down, close their eyes, gently tell them, okay, fine, just do a very simple breath in and out, but you can do a little bit of a bumblebee breathing, keep your spine straight, and do a relaxation response. And once all this thing happens, then you can do it. So that's the reality. Yoga therapy is not interested about the disease, but interested about the whole person. It is a part of medicine called integrative medicine. 15 years back, we were very few, but now we have almost 100 medical schools, there were 65 programs, 25 training programs. Now I have a board of integrative medicine. There is a physicians, and integrative medicine physicians are hiring yoga therapists. So yoga therapy is a little long program, also a very longer your training. Reason is that to understand the person's issue and understand how to answer to it and how to take care of it. It's very, very important concept. So you're using the same tools, you're using the same asana, same pranayama, but you learn how to pick and choose for that person. That's why after 200 hours of yoga teachers training, if you want to be a yoga therapist, it's a 500 hours extra, maybe 800 hours. And you can take a look at it, what are the different schools are providing. So integrative medicine, the most important thing is that they talk about that it's a relationship between patient and the practitioner. See, most of our modern medicine is a physician based. Yeah, I'm doing everything. I'm smoking, I'm drinking, I'm not following my lifestyle. I'm going to my doctor and say, hey, take care of me. But here, yoga as a therapist says, it's okay. I'm your integrative physician, I'm your yoga therapist, I'm your guide. But the ball is in your hand. You have to do it, you have to practice, you have to take care of yourself. Focus is on the whole person, looking beyond the body and mind to achieve optimal health and healing. Modern medicine is called evidence-based medicine, and this one called practice-based medicine. As I told you, people comes and ask me, how can I incorporate in practice? You to practice yourself first. Whatever I did this morning, whatever I showed you this morning, you know, I was not scripted, nothing, but I could do it because I practice everything. What I did, I shared my daily practice with all of you. So this is some funny slides. A friend of mine sent it to me, positive sign of global warming. Yoga therapy is experiential. You are the creator of your destiny. Nobody is going to take care of you. It is a transcendental. It is a beyond science. If you think about it, yes, we can explain a little bit of a science, but it is purely an experiential. You'll feel within yourself something is going on. And we, as a physician, we understand it well because we can feel the physiological effect of every asanas and pranayamas. It's also experimental because by the time you do it, you develop a different practice of yourself, and it's a lifestyle. It's an art and science of healthy living. And the day is coming when the physicians or you as a yoga therapist are going to write a prescription, yoga therapy for chronic low back pain. There is no other therapy for a chronic low back pain than yoga as a therapy. Cancer, metabolic syndrome. This is one which is incorporating, is a person called Dr. Dean Ornish. He wrote a book called Reversal of Heart Disease. He's being actually trained very close here. I don't know if you know the place called Yogaville. Yogaville is a little south of Charlottesville. If you don't know, you can Google it. They have all kinds of programs. All my friends are there teaching. I'm also teaching there. And Dean Ornish was trained from a physician from the Yogaville, and he's now the physician in your University of San Francisco. He has a program called Intensive Cardiac Rehabilitation, and they have a program all over the country. We have it here, is in your Centera healthcare system. And our program director, Amanda teaches yoga therapy in this program. It's called Dean Ornish's Lifestyle Program. And this is exactly what I was telling you from the beginning, not to master the postures, but use the posture in stages for therapeutic benefits. So always remember, don't push yourself. You practice with your eyes closed. Say, I'm always doing my eyes closed and doing it, holding the practices. And you meet where you are. So don't, even if you're doing a big class, they said, yeah, this is your ultimate. But today you start where you are. Staged approach that teaches a pain-free asana. If any pain, back off. effortless pranayama. Effortless means you can talk, you can sing, and a meditation, and it's basically taps in your body's own healing power, builds physical and mental resilience. So it's a relaxation response. And what does relaxation response means? Here it is. I showed it to you this morning. Here I am. I'm in an easy pose, Sukhasana. Eyes closed. Follow my breath and holding into with the mudras and mudras. Now my feet goes high up. This is your perfect pose. Is somebody's microphone off? Can you, all of you, mute yourself, please? I can hear a background sound. Sorry. Oh, next, I can get a half lotus. Then slowly I can get a full lotus. And this is only happens when you are relaxed. Even if you're going to try it, you're not going to do it. And if you try it, what will happen? You'll have a pain, you'll have a discomfort. But here, I'm in that sutra called Sthiram Sukham Asanam. I'm in stillness, I'm happiness, and I'm in asana pose. And this relaxation response, you call it preventive medicine. That's where the whole yoga therapeutic comes. Somebody who comes to you with a chronic disease, diabetes, hypertension, heart disease, say, yes, it's called secondary prevention, you can prevent, but it is a primary prevention. The first history we see, this is around 1969, that first, this is a yogi came from India called Swami Rama. He said, I can stop my heart. So he's a cardiologist because, it's a healthcare. He hooked him up with all his cardiac monitors and he literally could stop his heart, but he developed some cardiac rhythm problem. But in the hand, he had a two blood supply. He can shut down. He can do all this. He can control over autonomic nervous system. Then there's a physician named Herbert Benson, and let's see if I can do it. I can show you better. So Herbert Benson, he was from Harvard, and he went to call it transcendental meditation. During meditation, again, as I showed it to you, my heart rate monitors, that he could show that their heart rate goes high up. No, I need to see myself so I can see a little bit. Okay. So he went, and after he's studying all the parameters, he wrote a book called Relaxation Response. So if you look at a book at the time, it looks like it is all the effect of meditation. So meditation is the seventh limb, and meditation is a state when they get all the physiological benefit. So relaxation response is nothing but meditation. Here he continued his research in one of the paper published. He showed that yoga as a therapy causes genetic suppression. What is genetic suppression means? If you have a disease, like my father has a hypertension, my father has a diabetes, or my mother has a hypertension, or my mother has a breast cancer, I'm going to have breast cancer. Yes, you will. If you follow the same lifestyle that they're doing, but if you can bring this relaxation response and parasympathetic activation, that genetic expression is not going to express. That gene will be suppressed. That's called genetic suppression. That's what relax yoga therapy does. And it reduces expression of genes. Very, very important what he has shown. Is a best medical journal called New England Journal of Medicine. Just last year, 2020, published an article on yoga therapy. So it is getting integrated into our modern medicine. This is just a survey by Yoga Alliance and Yoga Journal. It was about 2016 or 2017, but we are seeing 2016. You're seeing more, almost 40 million people are practicing yoga in this country. It's almost $16 billion industry, and they're doing it for stress relief, good for your increased flexibility, strength, and performance. Very important. If you guys are interested, if you go and do a search called your Medline. Medline is a search. It's called a PubMed, P-U-B-M-E-D, PubMed. So if you go to the PubMed search, you will see, here is a called PubMed, that there will be over 6,000 articles on yoga therapy. And this is your funding called National Institute of Health is funding. I'm showing you this tape to show it to you where we are today. And most of the people who don't know. Same way we put a meditation, over 7,000 article comes up. This is the first, it was around 1973. The first research came up, yoga and biofeedback for the management of hypertension. For high blood pressure, people with when doing yoga therapy, blood pressure comes down. The blood pressure comes down, the medication comes down. Same way, they're showing this is the blood pressure, what they're coming down before, this is after. But the people who are not practicing, the pressure is not coming down. So very nice way of showing. The first, actually, the presence, what we see was an article first published in a very famous journal called British Medical Journal, Yoga for Bronchial Asthma. I'm showing it to you to show how far we came. This is in 1985. These are the all standard, medical journal. These are not research journal. This is called a JAMA, Journal of American Medical Association. 1998 had an article published, yoga therapy for carpal tunnel syndrome. Carpal tunnel, I don't know if you know, it's a compression of the median nerve, and it causes a lot of problem in your hand. It causes, loss of your muscle function, loss of your hand function. And these are the very standard medical article called Annals of Internal Medicine, which showed yoga therapy for back pain, spine, a very famous medical journal, coming up, yoga therapy for back pain. So, there is no end of it. And I just do it for showing it to the healthcare providers. Even this one called Journal of American College of Cardiology. They have a called yoga therapy for atrial fibrillation. If you have heard the word or not, the heart rhythm, it goes out of the rhythm. But when they publish an article on yoga therapy on such a renowned journal, that means it is here. So you guys have to pay some attention. Journal of American Heart Association, showing the meditation for cardiovascular risk reduction. So when you are practicing, or when you are a teacher, if somebody comes to you and says, no, I'm not going to take care of you, it's not going to work anymore. This is one called National Cancer Institute. They're one of the best medical cancer center in the country in Houston, called MD Anderson Center. They gave a funding for almost $4.5 million to do research on yoga therapy for breast cancer. They did a research with the institute in India, published in a very famous journal called Journal of Clinical Oncology. Another article, yoga therapy for breast cancer. Very interesting article, called a Journal and also Internal Medicine. The famous article says many doctors are prescribing, they call it unconventional medicine, or basically yoga. This is an article showing that, I told you that bumblebee breathing and Om sound, it quiets down, it cancels the frequency in your brain, so it quiets down. So you're like a chanting at the end of the practice is extremely, extremely important from the healthcare standpoint. This is the University of Virginia here in Charlottesville. They're starting a program which is called your Foundation of Medical Yoga for Health Professional. I help them training their teachers, and I'm also connected with them. This is the first yoga university I mentioned to you. Is in Los Angeles, goes by the name called Vayu. And even in the healthcare system, this is a new medical school. There's a medical school in I don't know if you know any place called Michigan. It's called Oakland University, called Beaumont Hospital. And the Beaumont, there is a whole, in a medical school system, they have a full-time yoga therapist, and the resident physician, medical student, rotates in that service to get training. This is one called Master of Science in Yoga. It's called Maryland University of Integrative Health, where we have some people from here. When I was teaching a class before pandemic, in a live, in-person class, one time there's a lady used to come to my class, and I saw her daughter came to my class. I said, daughter, yeah, she's practicing yoga. So she came. I said, what are you interested in? I'm going to have a master's in Maryland University of Integrative Health. She was one of the first one in the class. There are about 30 students. Guess what? Before they could finish the program, all of them have a job. So it's very not unusual that if you finish a yoga therapy program, almost all of them have a job. Recently, Cleveland Clinic hired 10 yoga therapists. This is one, a friend of mine, it's called Loyola Marymount University in Los Angeles. His name is Larry Payne. He's here. He's a good friend of mine. They go and visit the family practice called Venice Family Practice Clinic. They get exposed to the patients. And this fellow on the right is called Christopher Chappell. Chris Chappell is one of the a renowned authority on philosophy of yoga, and he teaches in Loyola Marymount University, Los Angeles. How yoga therapy works, and I think I mentioned to you during the class, we called it the name psychoneuroendocrinology. It's emotional brain called a limbic system. When yoga, it quiets down the limbic system. Sends a signal to call an area called hypothalamus in the brain. Hypothalamus sends a signal to a pituitary gland, which is endocrine gland, that sends a signal. It controls all the hormonal changes. So think about all the women, you see all the women in the yoga, because you know why? When the women practice yoga, they feel good, a good outcome. Why? Most of the functional women issues, premenstrual syndrome, your menopause, your pregnancy, all due to your hormonal imbalances. Then this is called altered hormonal homeostasis, and it corrects your homeostasis. It also connects through your autonomic nervous system and balances between sympathetic and parasympathetic tone. It controls epigenetics, very important term. Epigenetics means when you say, I am genetically destined to have the disease. My father has diabetes, I'm going to have diabetes. Yes, yes. But the gene has to express. That is called epigenetics. And yoga controls that epigenetics. So if you keep on doing yoga, we can guarantee you, if your even father has a diabetes, hypertension, you are not going to have it. And then we see somebody with hypertension, there are two kids. One kid has a hypertension at the age of 30, one is at the age of 60. For the other one day. So I'm going to give you all this information. I'm not going to go through because this is for a little bit more advanced, but you can keep it for your future references. Very simply in the breathing, it said that the inhalation is sympathetic, exhalation is parasympathetic. So always learn how to breathe out and always learn breathing out longer than breathing in. And once you can just incorporate that, that's your basic pranayama practice. We'll do pranayama, you will see we'll do a set of called your bellows, Bastrika, then breath of fire called Kapalbhati pranayama, alternate nostril breathing called Anulom Vilom pranayama, then you call a bumblebee breathing, Bhramri pranayam, Ujjayi pranayam, Om pranayam, Savitri pranayam, the name, there's the end of pranayamas, but most important breathing technique is breathing out longer than breathing in. So here it is, what you're talking about, that if you are even genetically predisposed to have a disease, if you continue a relaxation yoga therapy called a genetic suppression, prevents the onset of the disease. And this is one, this is called Cleveland Clinic. To put it down, they have a program. If you do the yoga program in the clinic, how not to end up in the hospital. That means a preventive medicine. They have 10 yoga programs a day. This is a labyrinth they use. This is a man, the first man his title is a chief wellness officer. We used to call a medical officer, it's a wellness officer. Secondary prevention. Now you have the disease. You have a breast cancer, you have a hypertension, you have a diabetes, you're genetically predisposed. Whatever you do to the lifestyle, you have the disease, now we got the treatment. You get the angioplasty, or for breast cancer, you get a surgery, chemotherapy, radiation. See what happens. You get a treatment for breast cancer, but after 10 years, 15 years, the cancer comes back. Why? Because your genetic changes are there, called oncogene. But if you continue a yoga therapy with genetic suppression, prevents the progression or even the reverse the disease. Tertiary prevention, it's called the prevent complication. Like if you have diabetes, you get eye changes for diabetic retinopathy, you get a kidney changes for diabetic nephropathy. If you keep on doing yoga, it's going to change your rehabilitation is very important. It's a better management of the disease, less pharmaceutical support, better quality of life. Like people like me, I had a open heart surgery about 20 years back. I'm continuing this everyday practice. For the last 15 years, I don't take any medication. I'm disease-free. I'm medication-free. I'm enjoying a quality life. I wake up between 5:30 and 6. I maintain a daily yogic lifestyle. It's called the yogic routine. And I'm like an Energizer bunny, Here I'm talking to you. I'll be taking a whole day of the classes, but absolutely no issue out of it, So it's very, very important. And in some cases, we see some cure. This is my book, what I showed it to you, called Yoga Therapy, Ayurveda and Western Medicine. I put two pictures. There's a picture of Albert Einstein, who's a scientist, and it's called Tagore. He's a philosopher. And he says, when a science meets a philosophy, it is all available through your Amazon, and it has all the book references. I have two DVDs, which is references. I have a couple of DVDs here, which are, this is the older one, the newer one is a DVD called Yoga Therapy for Health and Healing. Now, nobody's a DVD player anymore, but these are in my YouTube. If you can go to my YouTube channel, put my name, called Dilip Sarkar Yoga, and it has all the journal references in my book. So any reference you want to get, you can get it. So let me finish and show you a few things where we stand. Like books, there's a tons and tons of books, and a lot of things are going on in this country, yoga as a therapy, which you need to know a little bit to be proactive and to be ahead. And I will keep some 5-10 minutes at the end so we can do a little discussion. I want to hear your comments, what is you have in your mind. So the book Yoga as a Medicine, Meditation as a Medicine, this book called Yoga Therapy and Integrative Medicine. I wrote a foreword for this book. Actually, Dean Ornish, who started the program here in your center system, where Amanda works and myself were doing it. This is the first textbook we have for Principle and Practice of Yoga in our health care. This we use like a textbook. This is one of the research book. Another famous researcher in this country called Charlie Tallis wrote it down, research-based perspective on the psychophysiology of yoga. A new book, there's another famous book, evidence-based perspective on the psychophysiology of yoga. See, there's a lot of yoga books in the market, but you want to read the yoga from the authentic scripture. Authentic scripture is called a Hatha Yoga Pradipika. So I don't think I have a slide on that book, but I will make a slide. I will share with you. But otherwise, every book you read is get diluted by the person's own, I won't say biasness, but their experiential outcome. But Hatha Yoga Pradipika is really from your, we call it scripture. This is my DVD, the was the older DVD called Yoga Therapy for Health and Healing. It had a asana, pranayama, meditation. This is my new one called Yoga Therapy, Health and Healing. But these are all available through YouTube now in a digital format. This is one Dean Ornish showed that, when you had a relax, I think I showed it, told you this morning that this is the heart disease. There's a blockage in the arteries, and with the relaxation response, the blockage in the heart arteries even opens up. And he has a very famous program called Intensive Cardiac Rehabilitation, We've been using it here. National Institute of Health, they have this whole section called National Center for Complementary Integrative Medicine. They have a whole section on yoga. And the lady who is in charge, she's actually a physician, she's an endocrinologist. This is a journal. We have the association, remember, we call International Association of Yoga Therapists, the journal called International Journal of Yoga Therapy. Very nice article, very in all the articles. This is actually this is for a practitioner, like for all of you. And this is called CIAYT, Certified Yoga Therapist, which Amanda is, which I am. You know, we have about, I think, 15 certified yoga therapists in Hampton Roads. This is a yoga therapy program in the Harvard University. This is the yoga therapy yoga program in called Mass General Hospital. Massachusetts General Hospital is the main hospital of Harvard University. So when you have this yoga therapy program in the best of the best healthcare system, and you know it is here to stay. And there are some patients, I want to show it to you, like this man, Alan Brand, you know, he came to me, he had a significant heart disease, heart function is between 10 to 20%, and he was not inoperable patient. Comes to me after a while, he come, you know, he's doing a crow, he's doing a almost your, halasan, you know, plow. I said, yeah, it is great. You know, you go ahead and see your doctor, go to see a doctor now. His ejection fraction, heart function becomes almost double, 40%. He wanted to do a headstand. So I showed it to this morning, what to do a headstand. You don't do a headstand, put your head down, but then you see the effects of it. It is such a relaxation response by the time he could do it. Doesn't matter how young or how old they are. All the blood work got better. Because all the blood work happens, which you talk about it, when the food doesn't get proper digested. Undigested food and toxin becomes a high cholesterol, high fat, you know, high uric acid. The lady had a multiple sclerosis. She was in a wheelchair. We started doing it. She became more functional. She says, and I put a license plate called transforming. I said, yes, you know, Patricia, this is called transforming. This man has a Parkinson's disease. I teach a class in yoga therapy, Parkinson's disease. I was doing it in person before pandemic, but he got a profound improvement with this. This man has we call it a cardiac cripple. He has so many cardiac issues that cardiologists even gave up on him. But he started doing these balancing poses, mudras, and he's functional now. He was 77 and 16, 82. He's 82 now. And, you know, more functional than anybody can think about. This is a center in Portsmouth called the Septic Space. And there is a very large studio. The person who is in charge, this is Maury Cook. He had a cataract surgery. And people say, don't do anything after cataract surgery. But he was doing a headstand even before, all his life. So the surgeon who did a cataract surgery, he says, you know, you've been doing all of your life. I just took out your lens and put in, nothing will happen. Go ahead and do it. 6 weeks down the line, he's doing it. So if you keep on doing it before, nothing bothers you. Like in a pregnancy, people say, oh, you know, he's doing yoga. And yes, when you do during pregnancy, you start very slowly, very relaxed. But if you're doing it before, I've seen so many yoga teachers when they're pregnant, my gosh, they're in the third trimester pregnancy, they do touching their hand to the feet, they're doing their Paschimottanasana, they do everything as if nothing has happened. In fact, they're so relaxed, they go to the middle of the night, they get the delivered baby, and next day they come home. The lady had a Parkinson's disease. Look at a Parkinson, people like shaking like this, they cannot even stand. She can do the triples, percussion. There's a lot of other information here, which I want to, this is the first yoga therapy journal, which came up from India in 1920s, about 100 years. This is one of the largest yoga universities in the world, it's in India. This is the largest yoga research center, where they have a whole building research. And they have everything. They put a person in in a yoga posture, then measure their oxygen consumption, they measure their heart rate, they measure all the physiological function. And we do it through here, have this Apple Watch, and you get all these parameters through Apple Watch. It's called Evoke Potential, trying to show how far we came in yoga as a therapy, but most of the people have no idea. And most of the actual Western physicians do not have much ideas. We've been teaching for the last 12 years called Incorporating Yoga Therapy in Western Medicine as a continuing medical education. And we had over 300 physicians we have trained. These are all different yoga centers in India. This is another center, one of the world-renowned researcher here. When I visit most of them. This is a hospital in India. Whole hospital is being only modality is yoga therapy. This yoga therapy hospital. So let me tell you one thing. Where do we learn what is a yoga therapy is? When you see a baby will do everything in a yoga pose. So somebody took a candid camera and look at the babies. Babies feels better. Babies automatically stand in the mountain pose, tree pose. They sit down in a Vajrasana, Thunderbolt, or Sukhasana, easy pose. Why? Because something takes place within the body, and their mind doesn't know, and they know feels good. That's why they sit down. They'll get up into a cobra pose. They'll get up into a locust. They will be in a downward facing dog. They'll be in a cat pose. It's the natural there. It's a revolving abdominal pose. The seated forward bend, we try to do it and see how easily baby do it. But I have a grandson and I see he does all these poses spontaneously. Downward facing dog. In fact, it goes to a daycare, and daycare that teaches yoga down, because they said when they teach yoga, these kids are doing well. They're quite child's pose. We do all the child's pose for person who is psychological issue, nervous issue, and they do so nicely. This is the way they sleep. I think I showed it to you in the practice, the way baby sleeps. And we teach people who have insomnia to sleep like this, both pose. And this is the last one. This fellow from your Yogaville, the Swami Satchidanand, is invited to the University of Virginia. He was invited to give yoga therapy to 500 physicians. He said, illness and wellness, in circle's I, circle we, said, when you change I to we take care of all of our illness and wellness through yoga therapy. It's a wonderful experience, and unless you see, unless you understand, and you have no idea how introspection, how feel within yourself. Let me stop here. We have about, let's see, 7-8 more minutes. I'd like to hear any of your comments, question, because this is very important. You can unmute and talk, and let me go into the gallery view so I'll be able to see all of you at the same time. Go ahead. Who is the first one? Or who wants to volunteer? So I have something in the chat. Somebody wrote something in the chat. Do you have a 20 minutes necessary routine? Yes, we do. And what will happen to you is that by the time you keep on doing it yourself, and you will figure it out. I need to do this, I need to do this, and I need to do this. And if not even 10, 20 minutes, it could be, some doctor comes to me. He said, I have only 5 minutes in the morning. So fine. You know what? Go against the wall, keep your body straight, keep your spine straight, close your eyes, do some breathing out longer than breathing in. And he's doing it. Within a few weeks, he says, you know what? I was doing it 5 minutes, it was 10 minutes, 15 minutes. So the way to express it, 20 minutes is not the issue. Issue is to start the program initially initially, listen to this one, very important. Initially, you have to have a trouble finding time to do yoga. Essentially, yoga will find time to make your life organized and do everything in order. I had so much of issues. I said, how long? I said, yeah, 1 hour is good. Do 25 minutes of asanas, 25 pranayama, 10 minutes of meditation. I don't have an hour. Do it half an hour. I don't have a half an hour. How about 15 minutes? I don't have a 15 minutes. Pardon my expression. You know what I told the person? So why the hell you are living in this world? If you don't have a 15 minutes for yourself, is it worth living in this world? So remember, this is your art of self-healing. And you have to, and again, if you keep on doing yoga, you will see one thing. It sounds bad, but it's the right word, is that you will be selfish to the point that you will be doing things for your own. You'll be eating healthy, you'll be doing, and then very important concept, you cannot change anybody. I see all the time, this man comes, oh, I like my wife to do it. That's what I'm here. So why do you want your wife to do? Or a lady will come, I want my husband to do. So please, only person you can change is yourself. You can change yourself. But the moment you learn how to change yourself, what will happen? All the people around you will start changing. So I'm here 45 years, I can see all the people around me is changed. My daughter is a lawyer. Never, always wanted to do something. One day she said to my wife, Mom, I want to go to a yoga teacher's training. When she was practicing law, she went to yoga teacher's training. She became a yoga teacher. Now she's a pro bono yoga teacher. One day she said, you know what? I have some new students in my class. So my wife says, well, your son and your daughter-in-law, my son and daughter-in-law showed up. So what I'm trying to say, it is the whole world changes around you. What else? Any other comments, questions? Go ahead.
Do we have to become certified yoga therapists to teach yoga therapy?
Okay. At this time, no. At this time, if you run a yoga teachers, yoga therapy accredited program, you have to be certified to be the program director in charge of the program. You cannot run a program without a certified yoga therapist. Next, if you are charging money, or if you're think about, say, we are seeing we're very close that insurance company is going to pay now. Like your doctor is going to send it to a yoga therapist like you, a yoga therapist, and like I don't know if you know anything like a physical therapist, they get paid from the insurance company now directly. You will see there's a physical therapy centers. So you could be paid directly, but I'm sure at that time, insurance company will discriminate and will say, only we will pay you when you have a certified yoga therapist. But at this time, you don't, unless you have a accredited program you want to run. And we have about 4,000 certified yoga therapists in this country. Thank you. It's a very important question.
How many yoga therapy schools are there, like programs to attend?
Well, you can go to IAYT website called International Association of Yoga Therapists. Today, we have in this country about 180 to 200 yoga therapy program, but all of them are not accredited by IAYT. So you will get a certification from Yoga Alliance. When you finish your 200 hours, Yoga Alliance will give certification. But when you finish your yoga therapy, the certified will come from International Association of Yoga Therapists. That's the only association which is throughout the whole world. You know, there are 50 different countries were there. But when you go to the website, go to iayt.org. If you're in the computer, you can see iayt.org, and you will see all the schools. You will see all the accredited programs. And most of them are now online because of pandemic. You can pick and choose a program. You can do it from your home even. So it looks like somebody has an interest in yoga therapy. Very good. Proud of you. Who else? Who else has an interest in therapeutic yoga? All of you? None of you? Yeah, good. Good job. Okay, so you are going to go ahead and eat, and you are going to pay attention what you're eating. And I'm going to ask you, at least one of the volunteers, one or two volunteers, and I'll go over with you what are the signs of proper digestion of the food. How do you know food is digested? How do you know food is become part of your body? And how we will know this food is not going to be your high blood sugar, high cholesterol, and high uric acid. Remember, all these things in the blood work, what happens? Comes from your food. And why it comes from the food, and we'll talk about it. And yoga says very simple. We say we are what we eat. Yoga says you are what you digest. Unless the food is properly digested, the food has no value. And you talk about food, oh, eat this, eat that, do this veggie, do this. Hey, look at what Germans are eating, sauerkraut and sausage. Look at what the Russians are eating. Look at what the Mexicans are eating. Look at all the Europeans are eating. Look at the French. 6 eggs, 4 sticks of butter, food. I have a news for you. They're living longer than us. They live longer than the Americans. You know, the Germans live 4 years longer than the Americans. I'll tell you why. Okay, let's make it stop. If you don't have any comments, final comments, questions. I'm going to end this program so that you can come back and join again. Come back at 2:30. We'll do some practices, but that practice will be primarily a pranayama and a meditation. We'll be able to do in a chair, or if you want to sit in the ground, I'll be sitting in the ground, so you can do sitting in the ground after a little discussion. Okay? See you in 2:30. So that will be good. Now, so we are going to talk about a little bit on digestion. And remember, whole yoga and primarily yoga as a therapy is based on a philosophy, and the philosophy is called the Ayurveda. Ayurveda, and remember one thing, Ayurveda, let me see if anybody is waiting to join. No, you have the same link. So, okay, be sure. Yeah, Lynn has joined. So, Ayurveda, Ayu means your longevity, Veda means your knowledge. So, for all of your yoga teachers training, you're going to have a Ayurveda a section, and you're going to learn. So, in Ayurvedic philosophy and yoga philosophy, they comes from the same root, they are derived from the same origin, and we talk about in the same language. So, for a digestive purpose, what you talk about, why it is very important, because this is a part of the yoga as a therapy. Now, what is the reason? The reason is that our body tissue, our body cells is having a cycle of birth and death. like say our liver cells. In liver cells, older liver cells are dying, new cells are forming, new cells are functioning, and they're dying, another new cell is forming. And the word in medical term is called apoptosis, a controlled death. And we don't eat liver to replace liver cells. Our bones and joints, our cartilage are breaking down. We are having some osteoarthritis, degenerative changes, but we are not eating cartilage to make cartilage. We're eating some food. We're eating a piece of bread, eating a piece of meat, a piece of fish, or a veggie, or a soup. So what happened when you practice a daily, first of all, so there is a yogic lifestyle. In yogic lifestyle, you wake up between 4 to 6 in the morning, you sit down in a squatting pose, you drink a glass of water, and then you have a first bowel movement in the morning. Once you have a bowel movement in the morning, then you brush your teeth, you scrape your tongue, and you do wash your nose. It's called the neti part and nasal washing. All of them I have in my YouTube channel. If you go to my YouTube channel, you'll find everything. So then you have your breakfast, lunch, and dinner. Lunch is the main meal because that is the time when our digestive fire is very strong. Now, when you eat a food, our body only perceives the taste. Like whether it is a bitter, whether it is sweet, whether it is sour. Body doesn't know whether it's a protein, fat, or carbohydrate. Protein, fat, or carbohydrate, we made it. We made the food as that. Body knows the taste. So they said there is 6 tastes in the food, and based on the taste, body starts the digestive process. Why? Because when you maintain the yogic lifestyle, when you practice yoga, when you have a proper relaxation response, our whole digestive system is supplied by parasympathetic nerve. When you put a bitter has a very high digestive strength, and sweet has a very low digestive strength. So you put a bitter in the mouth, your body digestive fire starts. And all the digestion takes place in your stomach and is called the digestive fire. And the word in yoga and Ayurveda is called Agni, A-G-N-I, Agni. Agni is your digestive fire. And once you eat the food in sequence through the digestive process converts into all the body tissues. First, it will convert into plasma, then it will be red blood cell, then it will be muscle tissue, then it will be fat tissue, then it will be your bones and joints, then it will be nervous system, then will be reproductive tissue. Then it forms a substance which is called oja. Oja is primarily your body's immunity. When the food gets properly digested, you form a proper oja, proper immunity, and the immunity protects you from any exogenous or endogenous diseases, any disease from outside or any disease from inside. If you don't have a proper digestive fire, if you don't have a proper relaxation response, if you're in a very high stress, high strain person, that food doesn't get properly digested, food doesn't get properly transferred into all the 7 tissues, and you end up with what is called a toxin. The toxin in yoga is called ama. The toxin is represented in your blood as a high blood sugar, as a blood cholesterol, as a blood uric acid, you name it. So in diabetes, say the diabetes, we know diabetes is a receptor problem, diabetes is an insulin problem. All these things we know about diabetes. But yoga says, you know what diabetes is? Diabetes is that our digestive fire is low. Our body cannot digest sugar properly. That sugar is high up. So use a pranayama. That is called a breath of fire or Kapalbhati pranayama. will be practicing, they will see when you do a Kapalbhati pranayama, it ignites your digestive fire. So say for the diabetes, you do the digestive fire, you see that sugar will come down. So in this process of digestion, you will know that whether the food become properly digested. So how do you know food is properly digested? If the food is properly digested, the first sign will be, so remember, it's all introspection, it's art of self-healing. The first sign will be, there will be no smell in your excreta. If your urine smells, if your stool smells, if your perspiration smells, that means your food did not become part of your body. Food was not properly digested. So that is one of the first signs. Second, after food is properly digested, you will feel a proper lightness in the body and mind. The moment you feel heavy, the moment after food you feel heavy in your body and mind, or you feel a little sleepy, we call it the food coma, that food was not a part of your body. Appropriate natural urges, all the natural urges, like you become hungry in appropriate time, you're not getting hungry all the time, you get appropriate thirst all the time, you get all the appropriate natural urges, is a sign of proper digestion. No smell of any from your digestive tract. If you have a belch or if you have to release a gas, whatever will happen, there will be no smell. That is absolutely important, and that's what you monitor. And it's, remember, this is the art of self-healing, monitoring itself. So another thing, also very little nice thing is, after food, the food also describes in yoga is called as 6 taste and 7 coloring fruits and vegetables. It's not only green, not only red, 7 coloring of your rainbows. We call it a vibgyor: violet, indigo blue, green, yellow, orange, red. So you get all kinds of foods put together, and yoga says your main meal is going to be lunch. Lunch, because you are part of the universe, there is a sunshine that helps your digestion, and the yogic says that you should eat fruits as a separate. Now we see more and more, we know that all the fruits has an enzyme which interferes with the absorption of your trace elements. It's called your intestinal glycoprotein. Another one is called another enzyme called cytochrome P450, which interferes with the metabolism of your medication and other products. Now you will see a lot of medication, they will say, don't take it with the fruit juice, don't take it with the grape juice, don't take it with the apple juice. So yoga says, if you need to eat fruits, eat all the coloring fruits, but eat as an afternoon as a snack. Or if you have to eat a fruit with your meal, try to eat the fruit before. And then if you don't know how to eat a proper meal, said you go ahead, you eat from light to the heavy. You start from the light, then you go to the heavy food. And dinner is very small. Dinner is generally half the size of your lunch. Dinner should be about 2 to 3 hours before going to bed. Don't have a dinner and go to bed, because when you are sleeping, your body is not properly working, not properly functioning. And what happens, that food is not properly digested and become part of the toxic process. So the worst thing happens if you have a late night dinner and go to bed. Somebody will dinner at 9:30, 10 at the night and go to dinner, but you have a dinner about 2 to 3 hours before. Before going to bed also, you don't, Ayurveda or yoga does not recommend your midnight snacks. You should drink a glass of water or maybe a little glass of milk. And milk generally, yoga recommends to be a bit of a warm milk, not a little cold milk. Other concept is when you are eating food, you need to preserve your digestive fire. So don't drink a glass of ice cold water before. or also during digestion, your enzymes needs to work. So don't drink a large amount of water when you're eating food. You give a little time for the enzymes to work and then drink water afterwards. Now, at least before we go for a little bit of our practice of our pranayama and the meditation, which we'll do now, before, let's analyze at least one or two volunteers come up and say what you ate. Then we'll all make a little discussion and a little chatting. And so who is the volunteer first to tell me what lunch you had?
I'll go first.
Okay. Who is this? Jenna? Who's coming first?
Oh, sorry. I was having some issues with my mic. I'll go first.
Okay, go ahead. What
For
did you have
lunch,
for-
I had a mushroom burger with tomato, mixed greens. I had sweet potato fries and mandarin oranges.
Beautiful. Okay. First of all, there is another concept you have to understand in the body that we call our body type. You know, this is also called a Vata, Pitta, and Kapha. Vata people are very light, Kapha people are heavy, and Pitta people are moderate. Pitta people are very digestive. So you will understand this thing when you study the yoga a little bit more. But most of the time you have to learn that whatever you ate, that you pay attention if it's a taste. Say mushroom. You ate a mushroom. Think about what the taste of mushroom. What do you think the taste of mushroom?
I mean, I really don't eat for taste. I just eat it because
No, if you put a mushroom in your mouth,
Mhm.
what are you going to taste?
It tastes earthy to me. Just,
I'll add it to you. It's okay.
mhm.
What else? Mushroom will taste, so mushroom will be, even if you cook it, first of all, mushroom is very heavy, very thick, heavy. And this all consistency also has something to do. Mushroom, very interesting is that you'll surprise, it's a little bit of Swedish. There's a little bitter in it too. So, and then see, you ate a sweet potato, obviously, if any way you cook, it becomes your sweet. So what happens when you're eating food, the bitter taste. So if you put a bitter in your mouth, what will happen? You'll see you're starting having a saliva, you are trying to have so that tells you it starts your digestive process. If you put a sugar in your mouth, sugar, it tames your digestive process. Then after food, now you're going to watch that, do you feel heavy after this food? No, I feel a little good. I feel a little light. Whatever I ate for lunch, I'm good. I'm talking, I'm sitting, I'm comfortable. This is a sign that food has been already starting to digest because you already have an hour and a half or 2 hours after the food you ate. Tomorrow you will see that what is your excreta. Like in the last class, this young lady, she said, when she eats asparagus, very interesting, asparagus, her urine smells. So that telling her, giving indication that asparagus did not be properly digested. So what you need, there is some food material which you can use. We call it ignite the digestive fire. One of the ignite of the digestive fire is your little bit of a lemon. If you put a little lemon before, or sometimes when you'll see people will put a little lemon juice, a little salt also. And there is in an Indian spice, it's called a cumin. You soak the cumin in the water and drink little bit of that cumin water. It ignites your digestive fire. Another one which ignites your digestive fire is a little bit of your warm water. So you'll see if you go to any yoga places, and you will hardly find a cold water. Cold water is, we are all doing a cold water. You will never find. They will say, even throughout the whole day, they'll be drinking a little lukewarm water. So when you do that, and also few of the spices, say, people say, I cannot have it's a little bit of a black pepper. If you put a little black pepper, you'll be surprised that when you put a little black pepper, it ignites your digestive fire. In fact, when you put a little bit of your pepper, black pepper, or even like a green chili in a mouth, you'll see if you're not used to it, you'll be perspiring, you'll feel your whole body will turn hot. So taste creates a tremendous physiological changes in the body. So more and more you pay attention, more and more you do the daily practice of yoga, you will see your food becoming properly digested. See, people says, I'm gaining weight after eating food. I eat very little, but still I gain weight. What happens, the food converts into, say, plasma, red blood cell, muscle cell, fat, then it becomes a bone tissue, nervous tissue, goes sequence. But when you don't have enough digestive fire, it comes to the fatty tissue and stops. It doesn't progress anymore. It's a wonderful concept. And if you do it, and you will see how beautiful it is. Another one is keeping your mind quiet. So the food, remember, the whole eating is considered as a spiritual practice. So every faith you will see, everybody before food, they will do a little prayer for the food, that God gave you the food, prepare. What the spiritual practice means, that it is putting your mind in a calm state. He'll say the food you eat with a moderate pace. Don't eat too fast, don't eat too slow, moderate pace. Eat without any other distraction, that any other senses being working. That means, see, the worst thing you can do, that you are eating or driving a car, or you're eating and watching a television show, it's nice, but if you're eating and having a nice, say, beautiful music, if we get a nice classical music going on, or a little bit of nice piano. So if you see a nice, good dinner, you see somebody's playing the piano, but playing your very nice, smooth, a music. You don't see any high tone. So it is a very important, and that's what we'll be doing it. We'll be practicing a little bit of a pranayama, then we'll show you how you will slowly and slowly enter into meditation. People come and ask me, I want to do meditation. I say, what will happen? You need to prepare your physical body. So even for your digestion. See, our physical body is prepared now, that when I keep my eyes closed and I pay attention to my breath, I can keep myself quiet. Because if my physical body is not ready, what will happen? I will have a little bit of a pain when I'm sitting down, or will have feels like some ants are crawling in my body. I'm not properly, ready with my body. But when my body is ready, when my breath is ready, I enter slowly into the meditative state. So meditation is the total outcome of yoga practice. And that is the seventh limb of yoga. People will say, yoga and meditation. There's nothing called yoga and meditation. Meditation is your yoga. So And another concept of yoga is that whole yoga is, as I said, I'm exaggerating, but 99% practice, 1% theory. You really keep on doing your practices and you'll see everything will come to you. Now, your physical body is ready now. Physical body will see, once your physical body is ready, your food will get properly digested, but your breath will be ready. These muscles of respiration needs to be relaxed. So whenever, before you start a breathing, we call it a voluntary breathing practice, or you call it a pranayama practice, pranayam. Prana is called a life force. Prana keeps us awake, alert, and alive. Prana is not your breath. Breath is the carrier of prana, and the prana goes to every organ. In yogic tradition, your breathing takes place throughout the whole body. Not only your lungs does breathing, your skin does breathing, your kidney does breathing, your liver does breathing. So we'll do a practice at the end. You will see we're bringing that prana to the organ of healing. It's called a pranic healing. And all the sessions we do, this yoga teachers training session, we do primarily as a practice. So we generally do a set of pranayama practice, and the set of pranayama practice goes in sequence. And again, somebody asked me that 80 years old person having a congestive heart failure, do you have any yoga? Yes. 80 years old with a congestive heart failure, yes. He'll sit down in a chair and very slowly keep the spine straight, eyes closed, do the hand gestures called mudras, and do the breathing out longer than breathing in slowly. So now, all of you, if you want to do the practice session with the pranayama practice, you can, see if I can go to a little bit further down. I can put myself so you guys can see me, and you can put your speaker view, so you'll be able to see me and go over with me slowly, and I will guide you with the practice and what to practice. The first component of a pranayama practice or even a meditation practice is again and again, I'm going to tell you, 1,000 times, able to sit down in a chair or in a ground with your spine straight. The moment you do a hunchback, you really don't have much effect of a pranayama practice. Next thing we say, a straight spine and eyes closed. Then you do your mudras. It's very important. Mudras are called your neurophysical connector. It connects your body and mind to take the prana, the subtle energy, to the organ of healing. So if you touch your index finger and thumb like this is called a meditation mudra, oregano mudra. It quiets down your mind. Very, very important hand gesture mudra. If you bend your index finger down and put a thumb in the top, this is called your Vayu mudra. It controls your pain. If you have a pain, if you have got a chronic pain, knee pain, hip pain, back pain, you do the pranayama practice with this mudra. In fact, I also do asana practice with the mudras. We'll do a pranayama practice and you'll see, we'll do a Kapalbhati pranayama with all the mudras, and you'll see that each mudras have an effect. If you touch a middle finger and thumb, this is called your Shunna mudra or mudra of infinite. It connects you, call it space element. It is very good for your hearing. If you have a hearing problem, hearing issues, you touch your middle finger and thumb. If you touch your ring finger and thumb, this is called a mudra of your earth. It's an earth element called Prithvi mudra. It is for the people with the grounding, like people with diabetes, people with your truncal obesity. That's what you do with a mudra. Touch your little finger and thumb. This is called a Varun mudra. It is the mudra of your water. So all the water content in the body, like it has a proper function for your bladder. It improves your bladder function. It improves the water content in the body. And most important water content is the skin. People say skin, I have a dry skin. Dryness comes from inside, not from the outside. Even if outside weather is dry, you have to drink enough fluid to keep you properly hydrated. It helps. If you touch your ring finger, little finger, and thumb, this is called your strength, Shakti Mudra. Wake up in the morning, you don't have any strength, touch your little finger, ring finger, and thumb. If you touch a middle finger, ring finger, and thumb, this is called your Pachan Mudra, digestion mudra, Apana Mudra. It helps elimination, helps in digestion. If you bend your index finger down, this is called a heart mudra. It helps your heart function. It is called your Hriday mudra, your Apna Vayu mudra, there are a lot of names. And sometimes put your thumb high up, it's called a Linga mudra. It helps improving your body's heat and phlegma. Children do it all the time. So we'll do those practices with the pranayama. So after you learn how to do the breathing out longer than breathing in, always remember in every yoga practice you breathe out first. Then you do your breathing technique always a opposite of your normal breathing. So what is opposite means? Normally the inhalation is active, exhalation is passive. You'll be doing active inhalation, active exhalation. It will be like it's called a bellows. If you have seen a bellows, like your, say, a blacksmith's place or a bellows you can use to put your fireplace. So bellows generally it is, bellows will take a breathe in like this and then go breathe out. So you active inhalation, active exhalation. Somebody who has a problem with the breathing, somebody has a congestive heart failure, they cannot do, they can do very slowly. They can raise their hand high up. They can do slowly, breathe in, breathe out. When they breathe out, they like you to close the hand, like I call it yogic fist. Breathe in, breathe out. Then you do it with your eyes closed and pay attention to your breath, and you'll see it progress very slowly. Breathe in, breathe out. And you continue unless you have an effort in breathing. For us, We've been doing so long, we generally do in stages about sometimes 3 to 5 minutes. And when you are comfortable doing it, then what you do, you can do this breathing technique a little bit of first keeping your hand like this is a yogic fist. You can do raise shoulder. And if you keep on practicing it slowly and slowly, then what will happen? You see what will happen. Will happen to you, you'll be doing a lot faster, but without any effort. Like this thing will happen to you. Now, why don't you put you guys, all of you put in the mute. So if you put in the mute, so you'll be seeing me in the speaker view, and go to mute and put in the speaker view. So you will be able to see me and you will be practicing on your own. Mute your audio, and you like to use your video if you can, so they can see what you're doing. I'm watching all of you. So this is the beginning. This is your, now you are, all the retained carbon dioxide in the lung is being removed. Your lung is ready. Now if you do it, if you take a breathe out first, take a deep breath in, and the breathe out. You'll see now you'll be able to breathe in and out a lot more than what you can normally do breathing in and out. It's a wonderful practice. The word is called a bastrika, Sanskrit word, and English word is called a bellows breathing. Active inhalation, active exhalation. We do many a time, we do a lot faster, slow speed, medium speed, high speed, but those will come to you once you start doing it. Next is called Kapalbhati Pranayam, or breath of fire. That is your called metabolic pranayam that ignites your digestive fire. You have a balloon here in the abdomen, then you have a diaphragm here, then you have a balloon with a lung and heart in it. You will be having your awareness in the belly button. You will push the belly button to the back. That will hit the diaphragm. Diaphragm will hit the lung and air will come out. Active exhalation, passive inhalation, opposite of normal breathing. So again, sit down. Your hands you do in a mudras. This one you can use different mudras. Touch your index finger and thumb. And I do with my eyes closed, but if you want to see me what I'm doing, do. My awareness is the belly button. My belly button goes back and air comes out. If you're new to the practice, what you can do, you can put your hand in your belly button, another hand under the nose. So when you push it in, you'll see air will come out. Keep practicing it and see what will happen to you. Generally, what happens to you is that when you're doing this, you have no awareness of your breath. You are breathing in between without knowing. Why? The day you were born, you took a deep breath in. Nobody taught you how to breathe in. You learn how to breathe in, you learn how to breathe out. Then you use all the mudras to use this pranayama. Sanskrit name is called a Kapal Bhati. Kapal means your forehead, Bhati is a shining. What it says, when you do this pranayama, you develop your body's, ignite your body's fire, and then looks like you have a radiant coming out. Looks like there is a glow around your face. Looks like there is a flame around you. In fact, if you keep on doing practicing, people will say, look at you, looks like you are glowing. If it's a picture of Jesus, if it's a picture of Buddha, you will see there is a aura around their body face. So let's do a little practice. Let's do a count of 10 each, with each hand gesture called mudra. There are about 8 or 10 mudras we will do. And generally, when you keep on doing it more and more, I do it 20, 30, 40, 50 in each mudra. So sit down comfortably, touch your index finger and thumb. You continue doing it, and I will explain to you what is the benefit of this pranayama. Close your eyes, keep your spine straight, bring your awareness to belly button, and push the belly button to the back without moving your whole body. Nothing, no part of your body moves. 10 of them. Very slowly, 1 per second, no rush. Change your hand, put your index finger down, put your thumb in the top. Another 10. You keep on doing it, and I'll tell you the benefit of this pranayama. Don't stop, keep doing it. You can keep your eyes open to see how I'm doing. It massages your internal organs, massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your small intestine, massages your colon. For men, it massages your prostate. For the women, it massages your uterus. Change your mudra, touch your middle finger and thumb. It's a mudra of your space. Massages for the women, it massages your uterus, massages your ovaries, massages your tubes. Yoga says when you massage the organ function gets better. So this is therapeutic pranayama. Therapeutic pranayama improve the functions of your abdominal organs. The disease comes from the abdominal organs. Change your mudra now to ring finger and thumb. This is for your obesity and diabetes. If you have diabetes, if you have a abdominal obesity, sit down and do this pranayama with this mudra. Touch your little finger and thumb. It improves the function of your bladder. It also improves the function of your all the body containing water, like your skin and other organs. It also massages your diaphragm, which is between your abdomen and lung. You keep on doing it. Let me tell you the benefits. Touch your ring finger, little finger, and thumb. It improves your strength. It also massages your lung. Massages your lung. So the lung is like a balloon. So all the air, residual air, which is sitting in the lung is going to come out. You guys continue your practice, 1 per second. If you have any problem doing it, just close your eyes, bring your awareness on the belly button, push the belly button to the back. Massages your lung. In between the lung is your heart. It also massages your heart. It's a wonderful, wonderful pranayama as a therapeutic pranayama to ignite your digestive fire. Touch your ring finger, middle finger, and thumb. This is your digestion mudra. This is your excretory mudra. It removes, and it is very good for if you have any excess in your blood, excess sugar, excess cholesterol, excess uric acid. You do this pranayama with this mudra. Put your hands together, thumb comes out, the linga mudra. It brings the warmth in your body and very good for the phlegma, especially the children. When they have a runny nose, and children do it automatically, the hand mudras, you'll be amazed. You'll see that whatever children does is all based on the yogic philosophy. So this is the second practice. Sanskrit name is called Kapalbhati Pranayama. English name is the breath of fire because it ignites your digestive fire and makes your face glow. Very good for your metabolic related diseases. Next is the alternate nostril breathing. Remember, I told you in the practice this morning, you have an imbalance between both sides of the brain. You need to activate both sides of the brain. So in the left hand, again, do your meditation mudra, touch your index finger and thumb, put it over your left knee. Right hand, close your right nostril. You don't have to close all the way down. Just put your thumb underneath your right nostril. Close your right nostril. Breathe out through your left nostril first. Then breathe in through your left nostril. Drop your hand down. Close your left nostril with a ring finger and a little finger and breathe out through your right nostril. Breathe in through your right nostril now. Drop your hand down, close your right nostril with your thumb, and breathe out through your left nostril. Let's keep on doing alternate nostril breathing, and I'll tell you the benefit of this breathing. Breathe through one nostril, close it, breathe out through other nostril. Do with your eyes closed, and you'll see you will enter into a transcendental state very easily. These are the pathway to your meditation. This is the pathway of your transcendental meditation. Hands sometimes have a hard time doing it. Many a time what I do, I take my left hand, I support my right elbow with my left hand, and it really helps you doing it. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Left nostril breathing is called your moon energy, Chandranari. It is called a parasympathetic. It is also called Ida Nadi. Then what you can do, you take your index finger and middle finger, put it in between your eyebrows. This is your third eye. Then you close your eyes, bring your awareness into your third eye, and you continue alternate nostril breathing. The right nostril is controlled by your left brain. Left brain is analytical. Left brain is heating. Left brain is sympathetic. So right nostril breathing is called a sun energy, heating energy. Sympathetic is a fright and flight response. When you do the alternate nostril breathing, you activate both sides of the brain. You continue this alternate nostril breathing, in a short time you'll see you totally enter into a transcendental state without knowing. You will enter into a meditative state. Continue until you have any effort. If you don't have any effort, you can do it between 5 to 10 minutes of alternate nostril breathing. In a daily practice of 1 hour in the morning, you do 25 minutes of asanas, or the poses, 25 minutes of pranayama, or the breathing control, and 10 minutes of meditation. When you are in a meditative state, you will find very interesting, you will be able to do this alternate nostril breathing without even closing your eyes. Initially, it sounds almost impossible, but we'll do a practice. What happens when you do this meditative practice with your eyes closed, you enter into your called a subtle body. We have 3 bodies: gross body, subtle body, causal body. Subtle body is body of your mind. So what it is, my eyes are closed, I can clearly see my whole body. Take my one hand, I can touch my tip of my nose. Try it, practice it, and see how difference it makes. With the eyes closed, you'll be able to see the whole body. My left hand, my left index finger touching in between my eyebrows. Left hand touching my right shoulder. My right hand touching the right great toe. Left hand, my eyes are completely closed. My left hand touching right little finger. I can clearly see my body. So we'll do a practice. You will see, you will do alternate nostril breathing without closing your nostril, and that will be our meditative pranayama practice. Next pranayama practice is your bumblebee breathing. It's called your what you did this morning when you practice. You Brahmari pranayam, bumblebee. You shut down your 5 senses. You create a vibration. Your brain has a vibration. 2 vibration interacts, cancels, and it quiets down your mind. So technique is put your index finger in your forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ear and close your mouth. You breathe out through your nostril first. Take a deep breath in through your nostril. Breathe out through your nose with the sound of a bumblebee, like this. Let's do one more time to get a feel of it, how it looks, feels like. Breathe out first. Take a deep breath in. Breathe out with the sound of a bumblebee. Slowly take both of your hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you can remove your glasses, take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Eyes gets relaxed, face gets relaxed. Massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, earlobe, front of the ear, inside the ear canal. Bring your hand down, massage in front of your neck. This is called stimulating carotid sinus. It creates a relaxation response and massage in the lower part of the back of your neck. It's a wonderful practice. It's called a bumblebee breathing or a Bhramri pranayam. Then you learn the next breathing technique, and bumblebee breathing is primarily to your mind control. Quiet down your mind. It's a very, very important, very important technique. Then comes your called, I'm coming closer to you so you'll be able to see me, because this is important. You see me, so that it's called Ujjayi pranayam. Ujjayi called victorious. What is Ujjayi pranayam is, everybody does all different ways of Ujjayi pranayam. But Ujjayi pranayam is trying to close your larynx. What is the breathing? And try to breathe in. It's like a breathing through a straw. It's called a resistive inhalation. So what you will do again, you're sitting with your spine straight. I use a mudra in the hand. It is called your yogic fist, thumb inside and closed. It relaxes your whole body and mind. Put it over your knees. First, you will do is like a ocean breathing, like so what you do, you are doing, trying to close your larynx and trying to breathe in again, resistance, and slowly, when you get better and better, then you'll be doing a resistance breathing. First, you'll do like this. If you get a cough, entirely normal, because cough comes from your larynx. What it is, when you constrict your larynx, it stimulates your vagus nerve. Vagus nerve gets a signal, then it sends a signal back to your tongue, your soft palate, your snoring goes away, and your sleep apnea gets better. When you get a sleep apnea gets better, and you get a better and better this Ujjayi pranayama, victorious. So if you cannot do it first, it also massages your thyroid gland. It's very good for thyroid gland. So if you try with me, when you'll be able to do this properly, I can guarantee you, every disease is going to run away from you. They'll be scared of you. Wonderful practice. Resistive inhalation. You are inhaling, you are breathing in against the resistance. Try it one more time. Mm. 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 I do all these practices with my eyes closed. All these practices, these are called bandhas, locks, chin lock, abdominal lock, root lock. And also, I keep on changing my sitting posture so that I activate both sides of my brain. So improve your lung function. It improves also lung function because remember, we're trying to breathe in against resistance. Then you do resistive exhalation. Resistive exhalation is called a conch shell breathing. I don't know if you've ever seen a conch shell. If you go to Florida, they'll have a huge big conch shell and they will hold the conch shell and blow the conch shell and the whole sound of the ocean will come out. Generally, you all breathe through your nose. You don't breathe through your mouth. See, when you breathe through your nostril, we'll show it to you. I'll guide it to you soon that what happens. But when you breathe through your mouth, you don't idea where the air has gone. It's gone to the, either it's gone to your stomach or gone to your lung. But you do through the mouth. If you have to breathe through your mouth, you breathe through your nose. You can breathe out through your mouth. A lot more physiological. But if you breathe through your mouth, you have no idea. So, if you have a lung problem, if you have a COPD, pulmonary fibrosis, asthma, you want to improve your exhalation, longer exhalation, then want to build your lung function. So, I'm using my hand, using your yogic fist, the baby fist, you put one in the top. I will be breathing out first, then I'll breathe in through my nostril, and I will blow a conch shell. It will be conch shell, is a metaphor of conch shell, I'll blow it. So breathe out first. Take a deep breath in through your nose and blow against the resistance. Let's do one more time. Breathe out first. Take a deep breath in through your nose and blow against resistance. It's a wonderful practice. And then when you do that, then you take it, wow. You can breathe in and out maybe 2-3 times than your what normal breathing capacity is. The chanting in yoga is, we do a chanting called a Om chanting, but it opens up the lung. Om has a 3 component called a U-M, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So we have 3 hand gestures or mudras. If you touch your index finger and thumb, and if you keep your hands high up, this is a meditation mudra. It's called a Dhyana Mudra. But if you put your hands down, it is called a Chin Mudra. It opens the lower part of your lung. If you close your other fingers, it is called Chinmay Mudra. It opens the middle part of your lung. And if you put your thumb inside and close, this is also called a Adhi Mudra. It opens the upper part of the lung. So what we'll do, you will do the first, this is called a Chin Mudra. Touch this and put your hand over your knees. And then you will breathe out first. Take a deep breath in, breathe out with sound of a ah. Then you will change your hand to a, close your hand. Then again you breathe out, take a deep breath in and breathe out with sound of a oo, ah, oo, a, u. And finally you will get into your Adhi Mudra. And then you will do a ma sound. So let's do first, touch your index finger and thumb, put it gently over your knees. Close your eyes, breathe out first. Take a deep breath in. Close your hands down, Chinmay Mudra, put your hands down. It will be oo. So breathe out first. Deep breath through your nose. Oo. Then do your Adhi Mudra, thumb inside and close, put it over, it will be Ma. So breathe out first. Breathe in through your nose. So again, do pumping and cupping. It is very important. Keep on doing throughout the whole day. Somebody asked, can you do? Yes, yoga you can do throughout the whole day. As long as you don't do in a full stomach, it's okay. When you're warm, remove your glasses, put your hands like a cup over your eyes, let the eyes relax, and massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, front of the ear, inside the ear canal, ear lobe, lobes of the ear. Put your hand in front of the neck, massage the carotid sinuses. Take your hands in the back, massage in the back, the two muscles. So wonderful, wonderful practice. It can't be any better practice. When you learn all these techniques of all these, your physical postures and breathing, then slowly and slowly you enter into a meditative state. In a meditative state, what you do, you need a little bit of a focus. So people will do focus with the chanting meditation, or you can do focus on your breath, or you can do focus on a called visual imagery. Visual imagery means you're sitting in front of an ocean and you're visualizing the ocean, or you're visualizing a flame of a candle, or you're visualizing of a tip of a mountain. But most important visualization is your breath. So we'll do a little breath-centered meditation. Then we'll do alternate nostril breathing meditation, and that will be our meditation practice. This is the end of our session. So now you sit down. That's what everybody wants. I want to be doing a meditation, because remember, meditation is a medication. And if you put the words side by side, you'll be surprised. Meditation and medication, only difference is meditation has a T, medication has a C. I say meditation, T is for your transformation, C is for your choice. So sit down with your spine straight. Touch your index finger and thumb. Put it over your knees. Close your eyes and bring your awareness to the tip of your nose. This is called a breath-centered meditation. Visualize air is coming in through your nostril. Visualize the air is getting filtered inside your nostril. Visualize your nose like a personal air conditioner. If outside air is warm, it's going to cool it down. If outside air is cold, it's going to warm it up. Air goes to the side of the nostril, organ called a turbinate. Turbinate guides the air. Air goes into larynx, which is upper part of your respiratory channel. Visualize the air is coming behind your throat, coming through the channel called trachea into the upper part of the lung, coming to the middle part of the lung, coming to the lower part of the lung, almost to the level of your belly button. Just hold your breath very short time. This is called a cable kumbhak. And if you see when you practice it, your breath will get hold very short time in the end of your inhalation. Visualize air is coming out from the lower part of the lung, from the middle part of the lung, upper part of the lung, coming behind your nose, and it's coming out through your nose. Visualize air and the breath is picking up your life force, which is called prana. Every practice has a prana. In Chinese, they call it a chi. Yoga is called a prana. Breath is bringing the prana inside your body. And yogic tradition, your whole body does your breathing, not only your lung. Visualize. Visualize your breath is bringing prana into your lung, first behind your throat, upper part of the lung, middle part of the lung, lower part of the lung. Then the prana is going to the organ of healing. For me, I have a problem with my heart. I visualize prana is coming to my heart and causing the healing of my heart. It's called the pranic healing. I visualize the prana is coming to my back. I have a back pain, so prana is going to my back to cause the healing of my back pain. People with diabetes, prana is coming to your pancreas. Pancreas is sitting little behind of your abdominal cavity and is helping pancreas to make more insulin so that blood sugar is going to come down. I have a high blood pressure. I'm visualizing prana is coming to my blood vessels, relaxing my blood vessels, reducing the pressure inside the arteries. I have a hip problem, knee problem, I have a hip pain, knee pain. I visualize prana is coming to my hip, prana is coming to my knee, and prana is doing all the healing as possible. I stay in the silence with my eyes closed, and when you stay in the silence, you control your five senses. I'm talking because I'm guiding you, but for your daily practice, you just sit down with your spine straight, eyes closed, and do the visualization without talking. Then you bring your awareness to your nostril again. Now you'll be doing alternate nostril breathing without closing your nostril. Initially, it will feel like almost impossible, but you will see how meditative practice it is. This is called a meditative alternate nostril breathing. Visualize that your breath is coming to your left nostril. Visualize you're breathing out through your left nostril. Visualize you are breathing in through your left nostril. Visualize you are breathing out through your right nostril. Visualize you are breathing in through your right nostril. Visualize you are breathing out through your left nostril. I can clearly see and feel I'm breathing through one nostril and breathing out through other nostril. So for a nice little practice, let's quiet down, stay in silence, bring your awareness to your breath, and do the alternate nostril breathing without closing your nostril. We'll keep on doing it. When the time comes, I will give you a little cue and a sound for you to follow me again. We will be in state of silence. Slowly bring your hand in front of you. Touch your little finger and thumb. Separate your ring finger, middle finger, and index finger. This is the lotus mudra. It connects your body, mind, and spirit. Slowly bring the lotus mudra close to your heart. Heart is a site of the soul. We say all the time, memorized by heart. It's a wonderful experience of entering into a state of meditation. Yoga brings us wellness, physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Slowly bring your hands in front of your heart chakra. Put your hands together. And yogic gesture, the word in Sanskrit called namaste. Bow your head down, and it said, I honor the divinity within you. You are also divine. I'm also divine. And again, finish with another thumbing and cupping. We keep on doing it throughout the whole day. And you will see when your eyes are relaxed, you don't need any glasses. I have not seen any yoga practitioners wearing glasses. In fact, the one sitting in front of you is not even wearing glasses. You're wearing glasses, remove your glasses, put your hands over your eyes, let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face, massage behind the ear, in front of the ear, the tragus, inside the ear canal. Bring your hand down, massage in front of your neck a little bit. This is massaging your carotid sinuses, relaxation response. Massage in the back of your neck, full insertion of two muscles, trapezius and sternomastoid, which is supplied with a cranial nerve. You have a wonderful practice, wonderful relaxation. So this is what constitutes your therapeutic yoga. And I kept some time for all of you. So if you want to make any comments, if you have any questions, if you say anything on your, I don't see anything in the chat, so you don't have anything in the chat. And I'll be glad to answer any question, or we can go over with you the whole sequence, what we have done throughout the whole day. It will be, the whole thing is recorded. So I'll be sharing all the recording with you. So you'll have all the recording, you'll have all the slides, everything. This will be uploaded into your YouTube channel, and I will be sharing the YouTube channel link with you. So don't worry about if you missed anything, because it was a long day. There's a lot of information, but you will all have it tip of your finger, and you will be able to use it in your practice or in your teaching, both. So any comments, any questions?
Dr. Sarkar, hi. I have a question. Can
Sure,
you
go
hear?
ahead.
Okay. So it's about digestion. So if we eat something that changes the color of our urine or the color of our stool, is that also indicative of not properly digesting food?
Exactly. So you are absolutely right. See, say you ate some, even say coloring fruit like a beet. Beet is a very strong coloring fruit. Then you get some coloring of the beet, that is normal. You
Okay.
know that. Okay. But as I say, the other lady who shared with me, she ate some asparagus, and she also have a little bit of a coloring in the urine and a smell in the urine. Same thing as a stool, and you will notice it. The day you don't have any proper digestion, next day, even if you have a bowel movement, your stool will smell. But if food is properly digested, it is not going to. So little coloring from a strong coloring fruits and vegetables, it's okay. But there are not too many strong coloring fruits and vegetables. You don't have too many beets, the beets is, in fact, somebody even gets scared when they eat beet, the beet next day say, wow, my urine is almost red, what's going on? But that's normal, okay? So remember the smell, even your perspiration smells, it is really, yeah. Christelle, you have some questions? I saw your hand being raised. Are you asking something?
Yes. When you do your pranayama practice, do you do one? Do you do multiple different kinds?
Very good question. When you do the whole yoga practice, we do the asana practice, a relaxation. We rotate throughout the different practices, even throughout the whole day. Even day to day, I can do a hand relaxation one day, lower end relaxation next day, whole body, total body relaxation on the other day, balancing pose on another day. I change my asana practice. But pranayama practice is fixed. I do this set of pranayama. I will be doing the first, it's called a Bastrika bellows. And first I will do it as long as my body will allow. Then we'll do a Kapalbhati, breath of fire. First the Bastrika, inhalation, exhale. This is number one. Number two, and I'll be doing it all the mudras. Number three, alternate nostril breathing. Number four, my bumblebee breathing. Bumblebee. Number five, my Ujjayi breathing. Number six, my chanting breathing. Ma. And then I enter into meditative practice. That practice is fixed for every day because you are preparing your body for the pranayama and for the meditation, which are the healing substance. So if you think yoga therapy is a pill, the pill itself is the asana. But the main ingredient, how the pill works, is your pranayama. Mechanism of action is your meditation. Meditation is the mechanism of action, how the whole practice of yoga quiets down. So it's a beautiful question. As I said, you rotate your asana practice, but you do a fixed pranayama practice and meditation practice that will totally change your body and mind. And we say money back guarantee. So if your blood sugar won't come down, I say, another thing we'll do, people will say, I'm doing it, my blood sugar is still going higher. I'm doing it, my blood pressure is still going. You are doing too fast. You are doing too rapid. You are doing with the desire, you are doing with the outcome. You're trying to do, you said, if one is good, 10 is better. Like the kids. I take my grandkid only on a bicycle. Push, harder, more, faster. So this is built in. But whole yoga practice is, we call it work in, is not work out. Whole yoga practice is introspection, looking inside yourself, art of self-realization. And I practice this stretching all the time. And this is a powerful stretching. You should practice it. Able to sit down in a squatting pose and able to get up from the squatting pose without any support. Initially, it will be a problem, but practice. So I'm sitting in a squatting pose. From here, I'll get up without a support. Absolutely nothing, and I'll come and sit down again. Totally change your lifestyle. I can guarantee you we could keep on doing it. Anything else? Any other comments, question? Yes? Jenna, you have something? Somebody see raise hand? Go ahead, unmute yourself. You're muted now. Unmute.
Here we go.
Yes.
Okay, someone that has asthma that feels like they're already breathing at about 80%, would you recommend that they just start with the sitting up against the wall and trying to do the exhalation longer at first before doing any type of bumblebee or other type of
Perfect.
pranayama?
Perfect. See, you got the idea. Because your lung is the balloon. And when you have asthma, when you have COPD and anything, your lung is trapping all these airs. So unless you learn how to breathe out and pull everything out of the lung, so even think about this. I am here. See, I sit down in the squatting pose because it's so comforting for me that now, if I take a deep breath in, look at this. You know what is happening? This air is sitting in the top of that dirty air and it's not doing anything. There is no oxygen exchange, nothing. So if you're an asthmatic, you know what an asthma does? You can breathe in, but you cannot breathe out. So asthma would be, they're trying to breathe out. They get a tightness when they're breathing out. But what happened, they got imprinted memory that they have been scared. So you have to learn how to relax, but slowly, exhalation longer than inhalation. Then your bellows, all the other 3 sets of pranayama, and completely effortlessly. And you'll be able a wonderful outcome. But if you start doing it first in a very rapid breathing, which many practices does, it doesn't give a good outcome. Whole yoga practices as slow as you can do, as much as you let go, as much as the less competitive. The moment you get into competitive, there is no outcome with yoga practice. No competition, listening to your body's signal, no pain, effortless breathing will be wonderful outcome. Thank you. Wonderful question. So here we come, almost to our time now. I had a wonderful time with all of you, which I have always. And here is my friend, middle is sitting in the middle. Charmaine, you don't have any question for me? You always come to my class? No? See, yeah, fine. I see her all the time. I've been knowing her for years and years. Okay, if not, keep practicing yoga. You will be healthy, you'll be disease-free. Money back guarantee. And I'll be sharing with all the links with you. I'll send it to Amanda. Amanda will send it to you. Bye-bye.
Bye. Thank you.
Welcome. Bye-bye.
Bye now.